Yes, good morning, everyone. I hope I'm audible to you. Welcome, everyone, for this 2 days FDP on our SY Diploma syllabus as per ER 2020. So, in this, we'll be discussing everything that how to take the syllabus, how to take your subject forward with all the changes. Yeah. So, in this session, we'll be going through as you have gone through the flyer. We'll be going through different subjects of SY diploma, and we'll be seeing that how a faculty should be taking each and every aspect, the changed one as well as the older one, how to take it and what are the different references for it. So this we have taken, this FDP has been organized in association with Indian Pharmaceutical Association, Community Pharmacy Division, and Western Regional Center for Association of Community Pharmacists, Pharmacists of India. So in this session, I will be checking upon the first. Will be checking upon the. Just hold on a minute. Yeah, sorry for the interference. So we'll be checking upon the different aspects of pharmacology first today. Then we'll be going with community pharmacy and management. And at the end of the day, we'll be checking different aspects of biochemistry and clinical pathology. So that's for day one. And for day two, we'll be seeing the remaining subjects for it. So today at first, we have with us Dr. Vivek Kahare, sir. He is currently a lecturer in Department of Pharmacy, Government Polytechnic, Jalgaon. So he has 30. He has guided 34 MPharm students under his reference. He has a quite good of quite lot of industrial experience under his belt. He has worked in Zim Lab in Nagpur, then Genome Biotech in Ukraine, and the industrial trainer in Sun Pharmaceutical in Vapi. He was working as. He has done his PhD from Rashtrasan Tukadoji Maharaj Nagpur University. He has done his MPharm in General Pharmacology from Ukraine, and from his BPharm from Nagpur University. So we are happy to have you here, sir, Dr. Vivek Kahai, sir, today, and he'll be taking us and guiding us through the pharmacology syllabus as per the year 2020. Over to you, sir. Hello, Vivek, sir. Hello, sir.
Hello, am I audible to all of you?
Yes, sir. Yes, sir.
Yeah, very nice. So, very warm good morning to all of you, my dear participants. First of all, I would like to thank all the organizing team and especially to Aditya Guge sir and Somani sir that they have given me an opportunity to interact with you. Let us go on to the details what we have today assigned the job by the organizing team, and better to have a that I thought so. You are also the learner, if I am not wrong, and I am basically the learner. If my identity is anybody asking to anybody, then I will definitely tell them that I am the learner. Okay. So maybe you are the very well teacher and qualified professor and everything, but I am the learner. So let's have a teacher-learner interaction. Okay, I am trying to learn you something from you, uh, my dear participant, respected participant specifically. I would like to say you on this occasion. Just give me a second. I will like to share my presentation in front of you. Okay, my presentation is visible to all of you. Hello, am I audible?
Yes, sir, you're audible. Yes, sir, you're audible.
So let's have a discussion. Just wait. So, dear participant, today we will going to discuss on orientation on SYD pharmacy syllabi as per the uh, Education Regulation 2020. Okay, so I think first of all, थोडं आपण आज मोकळं बोलूया. नेहमी काय होतं, प्रॉब्लेम काय माहित आहे का, मी मराठीत बोललं चालेल का सर्वप्रथम?
Sir, yeah, a bit of Hindi mix.
घेऊया, थोडं हिंदीत घेऊया, थोडं इंग्लिश मध्ये पण घेऊया. बरोबर आहे. तर मला काय म्हणायचं आहे की थोडं आपण असं प्रोफेशनल बोर होऊन ऐकण्यापेक्षा काहीतरी वेगळं करूया असं माझ्या जस्ट माझ्या बुद्धीमध्ये आलं. तर आपण थोडं ब्रेन स्टॉर्मिंग करूया, म्हणजे सगळ्यांनी पार्टिसिपेट आहे बा, आणि मला तुमचा आवाज ऐकू आला की मग मला थोडा एन्थुझियाझम येईल आणि मी काहीतरी सांगण्यामध्ये मला सार्थकी ठरेल असं मला वाटतं. तर काही गोष्टी just for the brainstorming, because when we are enjoying the things, I thought it is more graspable and it is good for nice understanding. So मित्रांनो, let us see the orientation. So orientation आपल्याला खूप असं म्हणजे एकदम प्रोफेशनल वे मध्ये ओरिएंटेशन घ्यायचं आहे, समजून तर घ्यायचं आहे, पण त्याला खऱ्या अर्थानं काय कसं समजून घ्यायचं ते आज आपण बघणार आहे. तर मला मित्रांनो एक गोष्ट सांगा, कॅन आय हॅव वन क्वेश्चन फॉर यू? जस्ट हॅव अ फ्यू क्वेश्चन्स ॲज अ ब्रेनस्टॉर्मिंग. मला एक सांगा की आपली महाराष्ट्र हा कुणाचा?
Yeah, participants can type their answers in the chat box.
Yeah, you can type or you can speak. Yeah, no problem. Hello.
Yeah, so could you repeat the questions for them?
हा, मला एक सांगा की महाराष्ट्र कुणाचा? गुड मॉर्निंग एव्हरीवन. हा, महाराष्ट्र कुणाचा? सर्व भारतीयांचा. अरे क्या बात. मराठी माणसाचा. ओके. बरं, मग मला सांगा देश कुणाचा? देश आपला. व्हेरी गुड. आता मला एक सांगा, मुंबई कुणाची? सर्वांची. आपली. बर. अजून मला असा आन्सर नाही मिळत आहे. आपली, तुमची, सर्वांची. आमची. व्हेरी नाईस. समबडी सेज आमची मुंबई. सो मित्रांनो, मला काय सांगायचं आहे की देश आमचा, महाराष्ट्र आमचा, मुंबई आमची. मग सिलेबस कुणाचा? करिक्युलम कुणाचा? येस, व्हेरी गुड. आमचा चालू आहे. मला जिथपर्यंत सॅटिस्फॅक्टरी आन्सर मिळणार नाही मी थांबणार. तुम्ही चालू द्या. just go ahead, my dear participants. It's just PCI चा. Okay, somebody say PCI चा. Okay, सुजित देसाई सर, सागर सर, सगळ्यांचीच. ओके. माझा. व्हेरी गुड. ओके. तर मित्रांनो, आता याचा आपण जर खऱ्या अर्थाने मी तुमचा वेळ घालवणार नाही. मला आता मुद्द्यावर यायचं. मुद्द्यावर असं की करिक्युलम हा विद्यार्थ्यांचा, असं माझं ओपिनियन आहे. विचार करू शकता तुम्ही. हे व्यवस्थित आन्सर आहे की नाही मला सांग. कारण काय आहे माहित आहे का, हा विद्यार्थ्यांचा असतो. हे बरोबर कोणीतरी लिहिलं आहे, अफरोज मुलानी. येस. सो व्हेरी, विद्यार्थ्यांच्या हिताचा. व्हेरी गुड, व्हेरी नाईस. तो मला तेच म्हणायचं होतं मित्रांनो की somebody I want to answer from your side that the syllabus or the curriculum which we were designed just now, which is for the students. कारण आपण जेव्हा शिकत होतो ना तेव्हा म्हणायचं, हम लोग जब पढ़ाई करते थे तब लोग बोलते थे अरे हमारे वक्त का सिलेबस, हमारा सिलेबस, आमचा सिलेबस है ना. विद्यार्थी, आमचा सिलेबस वेगळा होता. आता हा विद्यार्थ्यांचा सिलेबस. तर माझं हे जे निष्कर्ष करण्यामागचं कारण जे आहे, मला काय म्हणायचं आहे याच्या मागचं रिझन जे आहे ते मला असं सांगायचं आहे की विद्यार्थ्यांच्या दृष्टिकोनातून त्यांना गृहीत धरून खऱ्या अर्थाने करिक्युलम डिझाईन ही केली गेल्या पाहिजे. राईट. सो दॅट इज द करिक्युलम डिझाईन. जर कोणी विचारलं की करिक्युलम डिझाईन ही कोणाला गृहीत धरून करायला पाहिजे, त्याच्यात ऑलरेडी लिहिलेलं आहे. नंबर ऑफ स्टेक होल्डर्स आर देअर. ओके. सो वी डोंट वॉन्ट अ स्टेक होल्डर, बट आवर प्राइम इम्पॉर्टन्स इज टू गेटिंग or designing the real curriculum. It is for the students, taking into the consideration of the students, their mind, their learning type, how they get learned, and what are the previous difficulties that we were arises while teaching, while understanding, or while delivering the lecture, and even the student cannot grasp what are the reason behind that. That is to be the some of the aspects which I wanted to put in front of you. Maybe you have something म्हणजे तुम्हाला काही त्याच्यावर असेल, पण हे माझं ओपिनियन मी तुमच्या समोर मांडत आहे. मला असं वाटतं तुम्हाला त्यामध्ये गोष्ट समजेलच मी काय म्हणत आहे. बरोबर आहे. तो विद्यार्थ्यांच्या हिताचा आपल्याला सिलेबस करिक्युलम पाहिजे असतो, कारण विद्यार्थ्यांना शिकायचं आहे. आपण जरी शिकवणार आहे पण विद्यार्थ्यांनी त्या गोष्टीला आत्मसातच नाही केलं, त्याला ग्रास्पच नाही करू शकले, वो अगर उस चीज को समझ ही नहीं पाए तो क्या करिकुलम और क्या डिजाइन, राइट. सो माय डियर स्टूडेंट, सो दैट्स व्हाई आई एम टेलिंग यू की आपण थोडंसं प्रोफेशनलिझम धरून आपण आपल्या या करिक्युलमला एकदा साध्या सरळ भाषेमध्ये किंवा साध्या सरळ समजून घेण्याचा आपण प्रयत्न करूया. मित्रांनो, काही ऍडमिन पार्ट मी तुमच्या समोर मांडत आहे. गव्हर्नमेंट ऑफ इंडियाने एक नॅशनल एज्युकेशन पॉलिसी लॉन्च केली. दॅट नॅशनल एज्युकेशन पॉलिसी इन 2020 or 2020, you know that. And that under that national education policy, under the national education policy, they have you know that the regulatory authorities किंवा त्याला काय म्हणू apex bodies. So Pharmacy Council of India is the apex body of the pharmacy profession, and they have taken their national education policies and priority because we were already our syllabus is 30 years before, that is in year 1991. Okay, so education regulation 91. So on that basis we were designed, and that were passed near about since 30 years we were applying the same syllabus, and number of students have gone through that and passed the diploma in pharmacy. Nowadays the diploma in pharmacy, there is a requirement of the new curriculum, that is the ER 2020. So ER 91 is converted into the ER 2020 for the diploma in pharmacy. This is the basic understanding related to that of the curriculum of diploma in pharmacy, which was designed by the Pharmacy Council of India and which is in front of you right now. So these are the points somehow I would like to tell you. Now, first of all, some of the, you know, that the orientation on curriculum, what are the changes into that of the previous and right now, the highlight changes. These are the highlights. Orientation on curriculum, year 91 and year 2020. These are the major changes. These are the major highlights that they were focused. And what are the advantage? You can say that disadvantage and advantage, right? So theory courses, previously in 12 theory course, you can see that 11. Practical courses 9, practical courses 10. Theory hours previously 850, nowadays theory hours 825. Practical hours 750. Now practical hours is rise, that is 800. You can see that. Okay, and previously there is no tutorial like of the concept compulsory in the syllabus, but here in the specifically in the curriculum they were you know that the tutorial, they have given the 275 hours specifically for the tutorials. So आता आपली ट्युटोरियलची गोष्ट निघालीच आहे मित्रांनो, तर एक गोष्ट विचारतोय मी तुम्हाला की त्याचे आन्सर मला तुम्हाला, कारण इंटरॅक्शन इज नेसेसरी माय डिअर पार्टिसिपंट्स. ओके, व्हॉट यू थिंक अबाउट द ट्युटोरियल्स? तुमच्या माइंड मध्ये जेव्हा तुम्ही ट्युटोरियल्स ऐकले तर तुमच्या पहिल्यांदा तुमच्या माइंड मध्ये काय आलं, आणि एक्झॅक्टली ट्युटोरियल म्हणजे काय आणि आपल्याला काय करायचं आहे या ट्युटोरियल मध्ये असं तुम्हाला वाटतं? तुम्ही मला टाइप करू शकता. Yes, group discussion, very nice, very fantastic answer. Yeah, Praveen sir, yeah, very nice. Then doubt clearance, yeah, Samir Khan sir. Quiz, thin pair share, okay. Quiz, okay, quiz is the okay. real link to, okay, the 3 pairs, then giving assignment, micro teaching, tutorial for the personal development of the student. Yes, a very nice answer which I have seen over here. Answers the questions of the focus on weak student. Yeah, fantastic. Rajeshri madam, fantastic. Problem solving. Okay. Test, puzzles. Okay. So many of the answers. Really enthusiastic participants, my dear organizers. And yes, basically, these are all the answers of the tutorials. And how it आम्ही त्याला कशा प्रकारे करायचं किंवा घ्यायचं एक त्या सांगण्यामध्ये मी तुम्हाला सांगतो की तुम्ही वीक स्टुडंट साठी म्हणताय, ग्रुप डिस्कशन साठी म्हणताय, मला एक सांगायचं आहे याच्यामध्ये, तुम्ही ट्युटोरियल घ्या एक स्पेसिफिक स्टुडंट साठी. बरेच लोक खूप छान छान आन्सर देतात. क्रिएट इंटरेस्ट टुवर्ड्स, या व्हेरी नाईस, काय सुंदर आन्सर दिलेले आहे निलेश सरांनी. क्रिएट इंटरेस्ट टुवर्ड्स टॉपिक. येस, आपल्याला एक टॉपिकला आपण बॅकग्राऊंड देण्यासाठी त्याचा यूज करू शकतो. आय थिंक ट्युटोरियल लेक्चर पर्पज इज टीच टू वीक स्टुडंट दोज आर पुअर इन स्टडी. व्हेरी करेक्ट सर. हाच खऱ्या अर्थाने उद्देश आहे. पण यामध्ये एक मी तुम्हाला माहिती, म्हणजे माझ्या एक्सपिरियन्स अनुभवानुसार मला असं वाटतं की आपण जर एक नाही का एखादा आपण ग्रुप केला आणि त्यामध्ये आपल्याला सगळ्या वीकच लोकांचा आपण जर ग्रुप बनवला, त्यापेक्षा ना हे गोष्ट बघा तुम्ही लक्षात घेण्यासारखी आहे की तुम्ही असा ग्रुप बनवा की त्या ग्रुपमध्ये 2 ग्रुप बनवा, 6-6चे बनवा, 10-10चे बनवा, किंवा ज्यांना प्रॉब्लेम असा स्मॉल ग्रुप बनवा. आणि त्या लोकांमध्ये काही मुलं असे टाका की ज्यांचं त्या विषयावर किंवा त्याचं अंडरस्टँडिंग चांगल्या प्रकारे झालेलं आहे. आम्ही जाणून सांगत आहे तुम्हाला. बघा, तुम्ही वीक स्टुडंटचा ग्रुप बनवा आणि त्याच्यामध्ये 1-2 मुलं असे टाका की त्याला त्या विषयाची थोडी किंवा त्या टॉपिकची ती समज झालेली असावी आपण शिकवल्यानंतर. बरोबर. What I am talking to you, that our role is very important. We are the mentors, we are the facilitator, we are the teachers who teach them, deliver the fantastic material in front of them so that they can understand. Okay, but whenever you are making the groups, make it a group with some of the students that they were. I am not telling the very charming students, very talented student. No, I am not using that word because every student have the talent. Okay, and even you don't. माझं ओपिनियन मी काय सांगतो, मी सरळ साध्या भाषेत बोलणारा माणूस. कोणाला तुम्ही कमी जास्त लेखू नका. त्या विद्यार्थ्यांना असं नाही वाटलं पाहिजे की हा आपण कमजोर लोक आहे आणि आपल्या कमजोर लोकांना अशा प्रकारे ट्रीट करण्यात येत आहे की त्यांना ती गोष्ट म्हणजे त्यांच्या आत्मसन्मानासाठी कुठेतरी ठेच पोहोचेल. अशा प्रकारच्या गोष्टी तुम्ही स्टुडंटला कॅटेगराइज करू नका. हे मुळात मला सांगायचं आहे. म्हणून वेन यू आर मेकिंग द ग्रुप, मी रॉंग आहे की राईट आहे तुम्ही याचं जजमेंट करा. आणि कदाचित मी जे बोलत आहे ते तुम्हाला जर समजत असेल तर तुम्ही राईटच म्हणाल, असं म्हणायला काही हरकत नाही. बरोबर आहे. तर राईट आहे की रॉंग आहे तुम्ही मला माझ्या चॅट बॉक्स मध्ये टाकत राहा, मी बघत आहे. पण मित्रांनो, अशा प्रकारे ग्रुप बनवा की ज्याच्यामध्ये त्यांचा वीक जरी असला पण त्यामध्ये असे 2 मुलं टाका की ज्यांना तो कॉन्सेप्ट समजलेला आहे आफ्टर युअर टीचिंग. राईट. सो अशा वेळेस काय होईल, तुम्हाला म्हणजे त्यांना असं वाटणार नाही की आम्हाला काही वेगळं काढलं. आणि त्यांचे जे प्रॉब्लेम आहे ते खऱ्या अर्थाने समजून घेण्याचा प्रयत्न ते करतील. कारण ते हे बघतील की या विद्यार्थ्याला थोडं समजलंय यार, मग आपल्याला का समजत नाही. मग नेमकं विद्यार्थ्याचं अंडरस्टँडिंग लवकर असतं. म्हणून त्याच्यामध्ये असे 2 मुलं ठेवा की ज्यातून ते समजून घेतील. आणि अशा प्रकारे त्याला कॅटेगराइज करताना या सर्व गोष्टींचा, या सर्व बाबींचा आपण यावर विचार केला पाहिजे. हम लोगों ने ये सभी चीजों के ऊपर, सभी मुद्दों के ऊपर ध्यान देना बहुत जरूरी है. दो इट इज, आपको ऐसा लग रहा है कि ये बहुत छोटी चीज है, नहीं, ये बहुत छोटी चीज नहीं है. मैं जो कुछ बता रहा हूँ आप इसको ध्यान में रखो, है ना. और ये चीजें जो है मुलांमध्ये मराठीमध्ये खूप छान हे आहे न्यूनगंड हा विद्यार्थ्यांमध्ये कधीच निर्माण नाही झाला पाहिजे. तो जर निर्माण झाला तर तुम्ही ट्युटोरियल मध्ये किती ग्रुप बनवले तर तो लर्न करू शकणार नाही, तो शिकू शकणार नाही, त्या गोष्टीला आत्मसात करण्याचा तो प्रयत्न करणार नाही. कारण त्याला असं वाटेल की मी डावललेला, वगळलेला, वंचित असा विद्यार्थी आहे, असं त्याला फील होऊ देऊ नका. अशा प्रकारे बघा, what I am talking to you, that is in very affective domain. We know that while understanding the curriculum, what as far as the outcome based education is concerned, psychomotor domain, cognitive domain, and the affective domain. So while grouping in the tutorials, you must have to be concentrate little bit on affective domain, right? So that's what I'm telling in front of you. Okay, kadachit हे तुम्ही समजू शकत आहात. Let's move on to the next thing. You know that these are the competencies we need to be inculcate or incorporate into the students. Okay, so as far as the curriculum says, okay, curriculum is already in the curriculum. They have given these all the 10 competencies: review prescription, dispense prescription, non-prescription medicine, then provide patient counseling education, hospital and community pharmacy, expertise on medication, proficiency on drugs and pharmaceuticals, entrepreneurship and leadership, deliver primary and preventive health care, professional and ethical legal practice. This is very, very important competency, okay? Because without ethics, without professional ethics, or without legal practice, because our pharmacy profession is the serving profession, and that is very necessary to incorporate in ourselves, in our personality or student personality. Once we incorporate in our personality, student can easily grasp it, because student already observing you in every time as a teacher, as a mentor, as a leader, as a facilitator. Your action, every action should be observed by the student. So you must have to be your personality should be how the professional in front of the student. At least what I wanted to say you, what I put across you. Okay, so professional, ethical and legal practice, and once they get understand, really the society can get this kind of the practice, legal practice, ethical practice, and that will be benefited to all community and society of the India, not only the India, it's the world. So it is get benefited out of that. So you can understand, my dear my dear participants, respected teachers, continuing professional development. These are the competencies we need to incorporate. See, here you can see that these are all the competency as far as the subject is concerned. Okay, आता तुम्ही यावरून डिसाइड करू शकता, यावरून तुम्हाला असं लक्षात येईल की कुठली कॉम्पिटन्सी कुठल्या सब्जेक्ट साठी मॅच होते. आपण स्वतःहून मॅपिंग करायचं आहे. ओके, तर मला काय म्हणायचं आहे, आता आपण हळूहळू आपण काय सुरुवात केली, आपण करिक्युलमची सुरुवात केली, आणि सेकंड इयरचा करिक्युलम मध्ये आज खऱ्या अर्थाने आपण बघत आहे की काय काय यामध्ये दिलेलं आहे. आणि हे सुरू करत असताना आता आपण हळूहळू आपण ओरिएंटेशन टुवर्ड्स कोर्स, कुठला कोर्स, तर माझ्याकडे दिलेली जबाबदारी आहे ती थोडी बहुत फार्मॅकोलॉजीला आपण थोडा जास्त वेळ देणार आहे, आणि त्यावर आपण भाष्य करणार आहे पुढील येणाऱ्या पीपीटी मध्ये किंवा पॉवर पॉइंट प्रेझेंट मध्ये किंवा स्लाइड मध्ये. तर मित्रांनो, मला एक सांगा की यामध्ये आपल्याला मॅपिंग करायचं, आणि मॅपिंग करायच्या वेळेस कुणाला असं वाटते की यामध्ये कुठली कुठली कॉम्पिटन्सी आपल्या सब्जेक्ट मध्ये येते. Hello sir, we are from Telugu states, could not understand the local language, so can you please converse English? Okay, yes, definitely sir. Thanks for your yes, Priya madam, yeah, definitely I will try to be in English and somehow in Hindi if you could. Otherwise, I will try to in English also. I will definitely convert this whatever the speaking or local language into the English. Okay, thank you. Okay. So what I wanted to say that whatever the orientation on curriculum competencies is competencies are mentioned over here, we need to map with that our pharmacology subjects. So what are the different competencies you need to map with our subject as far as your that understanding is concerned. तर तुम्ही मला चॅट बॉक्स मध्ये यू कॅन चॅट बॉक्स यू कॅन ट्राय टू that message me in a chat box, speak with me in a chat box, or tell me the competency. Yes, number of 2, 3, 5 competency can be mapped. Okay. Yes, what sir says that. Okay, Mahadev sir. Yes, Mahadev sir says that 2, 3 is a dispense prescription. Okay, very correct. Provide patient counsel. Very nice. Okay, and 5.1 is the expertise on medications. Okay, very correct. These are all mapped. I am completely agreed. Anybody with that? Even 8 is deliver primary and preventive healthcare. Okay, deliver primary and preventive healthcare. Very good, sir. Okay, Mahadev sir again. Soyab sir 3 and 5. Okay, 3 and 5. Which one is that? Provide patient counseling, and 5.1 is expertise on medications. Okay. Okay. So let us see which is going to be mapped. Okay, 2, 3, 5. Someone says Varsha Bhoje madam. Then Mahadev again said 10th will be the, yeah, definitely 10th is for the every subject. Yeah, I'm agreed. We completely agreed, Mahadev sir, with you. Yeah, and specifically, I would like to tell you in front of you that this is for the all subjects. Then Sagar sir, 2, 3, and 8, 5, 6, and 10. Okay, yeah, these are the very nice answers which I will get it in the chat box. Let us see. These are the answers. Is really going to that map. Okay, 5, 6, 10. Geetanjali madam, right? Right? Anybody? Yes. Just try to that why I am. This is the brain exercise which is needed. Okay, and when we are trying, we don't want to be bored. So kindly be use your brain. Yeah, 2, 3, 5, 8, 10. Yes, yes. I am not. Yeah. Yes, madam, Zado madam. Yes, it is very 2, 3, 5, 8, and 10. Okay, okay. Let us see. Thoda, that mapping is going to be increases as far as the subject is concerned. Okay, and what your brain says that is in front of me, and please say 5, 7, 8. Okay, Samir Khan sir. Yes. Okay, so let us see as far as my point of view what is in the mapping. Okay, माझ्या point of view, according to my point of view, क्या क्या मैपिंग हो सकता है हमारे सब्जेक्ट के साथ में, वो हम लोग आगे देखने वाले हैं. तो हम लोग देखते हैं, और जिन्होंने आंसर किया, those who are answering very well. Okay, so let us try to understand the mapping. Either you are right or wrong. We'll have to check it over here. Okay, so orientation on course. Yes, review prescription. कौन कौन मेरे साथ में एग्री है? फर्स्ट ऑफ ऑल आता आपण हळूहळू मॅपिंग. अरे बापरे, राईट यार, खूप लोकांनी छान आन्सर दिलेले आहे. व्हेरी नाईस. तर आता बघूया मी जे टाकलेलं आहे. somebody says 1, 2, 3, 5, 6, 8 and 10 completely mapped. Miss Saili Patil madam, You are very well correct as far as our orientation, as far as our pharmacology subject is concerned. And this is the competency which is completely mapped with that. How it will going to map? Let us see. Okay, Komal Shinde, yes, madam. She has told that she has her point of view that all points are important as far as my view. Okay, madam. With respect to your answer, maybe you are correct. We are trying to just map, and then you will have so most of the points. You can say that better have all points, but most of the points. Right. So let's have the review prescription. Review prescription. Rajeshwari madam wanted to say something. She has raised the hand. Okay. Anyways, so review prescription. Yes, definitely. For reviewing the prescription, you must have to know the pharmacological terminologies and their generic name, brand name, we can say that. Specifically, that kind of the how to review the prescription that is in the specifically in Sutex. But review prescription with respect to that of the drug and medication, that is going to be, we can say that. Then dispense prescription, yes, while dispensing the prescription, you know that the diagnosis is written onto that of the prescription, and according to diagnosis, if you are seeing the what are the content into that of the medication that you will going to see, and if it is not matched with that, so that is the dispense prescription. So while dispensing the prescription, you can understand while dispensing the prescription on the basis of the content. Okay, so dispense prescription, non-prescription medicine, provide patient counseling. Yes, if you are having the pharmacological actions, uses, contraindication, dose schedule. Okay, then in that situation, you can counsel the patient, and if you know the somehow the physiology and pathophysiology. Okay, so this is not related to the complete, but somehow with respect to that of the medication, if you are aware about that, okay, so you can counsel the patient very well. Okay, then expertise on medication, yes, definitely. When while discussing with that of the pharmacological subject, that expertise on medication, that is our base of that of the subject. आपण मेडिकेशन्स मध्ये एक्सपर्टीज होतो कारण आपल्याला एवढं तर माहित राहते की कुठल्या पॅथोफिजियोलॉजिकल किंवा ॲबनॉर्मल कंडिशन साठी कुठल्या प्रकारचं क्लासिफिकेशन या फार्माकोलॉजी मध्ये दिलेलं आहे आणि त्यामध्ये कशा प्रकारच्या मेडिकेशन चालू शकतात, पण आपल्याला ते स्वतःहून द्यायचंच नाहीये. दॅट इज ऑन behalf of the prescription of the registered medical practitioner, right? So आपण expertise असणं म्हणजे right medication, right time to the right patient, that is our duty. We can do it on the basis of this particular mapping, this particular competence. Proficiency on drugs, okay? आपण, you can see that the proficiency of drugs and pharmaceutical that you can understand through that of this particular map, you know that competency or with respect to that of the subject. Then deliver primary and preventive healthcare. Yes, somebody already has given these are the all points, and some have given the sum of the mapping and continued professional development. These are all the course mapping with respect to that our subject. Okay, and it may be as far as our background is from that of the completely pharmacy, and somebody with respect to madam, त्यांनी सांगितलं, somebody says that these are all points is going to be matched. Yes, maximum point we need to map it, and her brain and point of view we are going to see while discussing in a question answer session. Okay, so this is as far as our curriculum, new curriculum is concerned and our subject is concerned. Okay, these are all the mapping in front of you, and which is very, very necessary, my dear respected teachers. Orientation of pharmacological course. Okay. Now we will move on to our subject. What today I need to be have somehow discussion on the particular pharmacology subject as per as new curriculum. So my dear learners, what they mention into that is the course code as far as the ER regulation, education regulation by the PCI. You can see over here ER 2021T. Okay. It is related to the theory. Okay. Then they have given the 75 hours, and that means 3 hours per week. Okay. For that particular pharmacology course. Rather to have a subject, we can say that course is for our program. Okay, as far as outcome-based education or the when we are talking about the MBA point of view, this is or as far as our new syllabus, new curriculum is concerned. Rather to avoid using the syllabus word, using the subject word, or using the that program word is necessary to be used. Okay, so the program, then we can say that the course which is necessary to be used, and as far as overall the curriculum. Okay, so course code ER 2021T. So they have allotted 75 hours for the same. Then under that, the MSBT, Maharashtra State Board of Technical Education, what they have given the teaching and examination scheme. Under that, the syllabus comes under the J scheme. Okay, so while writing our program or our course, you can say that PH2J. Okay, second year this is for the second year, and J is the scheme of the MSBT, right? Then you can say here the course abbreviations. For the theory, pharmacology theory, there is a PGT, which is very minor point, but we need to understand, because as far as the examination point of view, while daily routine we are using, these are the short forms of the subject, and even these are the short forms in many times we are using. So you need to understand the abbreviation, course abbreviation. Our course is the pharmacology, and their course abbreviation as far as MSBT is concerned is the PGT. Okay, pharmacology theory. Then course code, you can see that 2022-1. Okay, these are the course code which is mentioned as far as the Maharashtra State Board of Technical Education. Then course abbreviation for the pharmacological or pharmacology practicals. That is, the PGP is the abbreviation which is used for that of the particular subject. So for the theory subject, PGT, theory course, PGT, and practical course is the PGP, right? And the course code for the same is 20056. This is the course code with respect to that our pharmacology course, which is mentioned by that of the MSBT as our examination and teaching, which comes under the Maharashtra State Board of Education as far as the diploma in pharmacy is concerned. So we will have to use regularly while taking the sessional examination, while taking the final examination. So which is in front of, right? Orientation. Now, related to the pharmacology, we will going to see scope. What is given the scope as far as the curriculum of the pharmacology is concerned, pharmacology course is concerned? What are the scope of this particular course? different classes of drugs available for the pharmacotherapy of common diseases. Okay, we need to, because that is the real scope. We can understand the different classes of the drugs available for the pharmacotherapy of common diseases, because whatever the class I mentioned into that of the pharmacological subject which is related to against any of the abnormality or the disease condition, disorder conditions, what are the treatment which is required, and specifically they have mentioned the classification under that subject. Then the indications for use, whatever the different classifications or a drugs. So what are the use of that drug? Indications or use. Then dosage regimen. Dosage regimen is very, very important as far as the different class of the drug. Okay. So dosage regimens mean how much time in a day or repetition of the dose, duration of the drug therapy. Okay, these are all the dosage regimen which is respect to that of the pharmacological course scope. Okay, then routes of administration, pharmacokinetic and pharmacodynamic routes of administration, which route is going to be preferred specifically, and routes of administration, understanding of routes of administration, understanding of dosage regimen, or basically I can say that fundamentals of that all the dosage regimen, uses, routes of administration, pharmacokinetic. Okay, pharmacokinetic we know that ADME, pharmacodynamic we know that mechanism of action. Okay, and then the contraindication of the drug. Okay, so indication and contraindications. Okay, so what are the uses and in which condition we are not going to use that particular medications. So that kind of the somehow expertise we can inculcate in the student personality or in the student knowledge or information. We can try to incorporate into the students by delivering the different lecture, and this is the scope of this particular pharmacological subject. So through that scope you can understanding the importance of the pharmacological course, because without knowing that, without knowledging of this particular different classes of the drug, their dosage regimen, their uses, which routes are going to be preferred. Okay, so either it is oral, either it is you know that intramuscular, intravenous, whatever they be, parenteral means specifically parenteral and oral and topical, which route is preferred we will going to be, understand. Then pharmacokinetic, pharmacodynamic, yes, without understanding this particular flow, we cannot even the and this is the under the scope of the pharmacology. Then contraindication of the drugs. Then orientation of pharmacology. What are the course objectives? These are the course objectives as far as our curriculum is concerned. Okay, so that course objective is somehow, this is the overall course objective. Okay, so you need to understand what are the course objectives. These are the objective of this pharmacological course. So general concept of pharmacology, including pharmacokinetics, pharmacodynamics, route of administration. Okay, then pharmacological classification and indication of drug. Yes, dosage regimen, mechanism of action, contraindication of drug, and adverse effect of the drug. Yes, without adverse effect, because every drug having their effect, either therapeutic effect or another is the adverse effect. So common adverse effects basically we must have to understand, and that is our again the objective of this of the pharmacological subject. Means through that we can understand the pharmacodynamic, means their ADME parameters, means their administration, distribution. So these are all the metabolism. Okay, so these are expression. These are, you know, all that, everything. These are very basic things. Then pharmacodynamics. Then routes of administration. Okay, so general concept, that is the main objective of this particular course. Then classification, indication, dosage regimen, mechanism of action, contraindication, and adverse effect of drugs. Then you can see that in our curriculum, these are the course outcomes. What are the objective? That is the different thing. This is the objective of this particular pharmacological course. And that objective, now the student will fulfill or not. So what are that? The orientation of the pharmacology, that is the course outcome we will going to see. Means after the completion of this complete pharmacological course or curriculum, which was given by this PCA or MSBT, we can say that. So upon successful completion of this course, the student will be able to, what the student have inculcate in his personality after learning this particular pharmacological course, that is to be the course outcome. So upon successful completion of this course, the student will be able to describe the basic concept of the pharmacokinetic and pharmacodynamic. They must have to be described. They must have to be understood. That is not related to the one system. When we are talking about the central nervous system, they are talking about the gastrointestinal digestive system. When we are talking about the respiratory system, cardiovascular system, there are different classification included into that, and they must have to be explained all the concept of pharmacokinetic. But one thing, keep in your mind, my dear respected participants, that is, you must have to be taken into the consideration of diploma in pharmacy. These are the students of diploma in pharmacy. We are given them a knowledge in a such a way, in a such a language, such a you know, that you can use as the different tricks and different strategies, so that the students can understand the things. That is, you know very well, because you are the teachers. So we have to use the very easy concept, understandable concept with respect to the student mind and student era is concerned. We are going to tell them that whatever the things, so that they can understand and they can reciprocating the concept, or they can reproducing the concept after our delivering, or after our explanation, after our description, after our practical and theoretical explanation. They can we describe the basic concept of pharmacokinetic with respect to all the systems, which is mentioned into that of the pharmacological course, and pharmacodynamic too. Enlist the various classes and drugs of choices for any given disease condition. They must have to be enlisted. Means, if suppose any of the disease in front of them, they must have to at least enlist. What are the drug of choice for any of the conditions? Is in a very basic antipyretic, they must have to know that paracetamol. So they must have to understand the which are the, you know, that the drug of choice for that analgesics. So when we are talking of the analgesics, they must have to know the NSAID. So these are they have to be at least enlist the various classes which is related to the diploma in pharmacy. Okay, so teach them in a depth, having the course of 2 years डिप्लोमा इन फार्मेसी. हम लोगों को उन स्टूडेंट को ऐसा पढ़ाने का है कि उनके लेवल के हिसाब से और ये प्रोग्राम के हिसाब से हम लोग उनको कितना डेप्थ देना चाहिए और वो उतने ड्यूरेशन के लिए सफिशिएंट है। हम लोगों को हमारा यू नो दैट वी आर मेकिंग द प्लान्स ओके बिफोर टीचिंग। अपन D1 D2 बनवतो वी आर प्रिपेरिंग द D1 D2 टीचिंग प्लान ओके प्रॅक्टिकल प्लान ओके एंड दिस इज फॉर द स्टुडंट्स। तर असे प्लान बनवा, असे अवर्स त्याच्यामध्ये व्यवस्थित हे करा की यू नो दॅट द स्टुडंट्स कॅन इझिली विन अंडरस्टँड द थिंग्स ओके। आणि या लेवलवर जेवढी गरज आहे तेवढंच द्या। उगाच आपण काही काही गोष्टी जास्त द्यायला जातो आणि जे आहे ते पण त्याला समजत नाही असं नको व्हायला। म्हणून जे साध्या सरळ सोप्या भाषामध्ये त्याला पहिले बेसिक फार्मसी मध्ये नेमक्या आपण काय गोष्टी इन विच डेप्थ वी आर गोइंग टू टेल देम, हम लोगों ने कितने डेप्थ तक उसको पढ़ाना चाहिए ये हम लोगों को पहले डिसीजन लेना है और उसको सही समय पे उसको खत्म करना है और उतने रेंज में ही खत्म। वैसे एक करिकुलम that is to be designed in a such a way and that's why they have given the proper hours okay and even the course outcome and the practical outcome and whereas the objective and the scope of this curriculum they were already defined in this particular curriculum by the PCI. That is the great advantage of this particular curriculum. Okay, they were already going to be given and we are going to be mapped even with that of the competence. What are the competency? That's why we are discussing today the competency, which are the competency which is needed to be inculcated in our student personality. According to that we are giving the we are giving the lecture delivery in a depth. Okay, so describe the basic concept of pharmacokinetic and enlist, then advise the dosage regimen, route of administration and contraindication for a given drug. Okay, they must have to advise the dosage regimen. Yes, at least they when the patient comes in front of them, even they are participated into the discussion with that of the medical registered medical practitioner, with the doctors, with the nurses or healthcare profession. When they are trying to discuss with each other, the pharmacist is playing the very important role. And in that situation, the student must have to be explained at least when they know that dosage regimen, when they know the route of administration, when they, because anybody of the patient is not cooperate with that of the oral route, then what are the another alternative? If any of the topically or intravenous route, the vein are not properly been objecting or locating in such a patient, then in that situation, what are the other alternatives? To incorporate the drugs into that of the patient body. So these are the practical things immediately come in our mind, and that is to be tell them to our students. So advise the dosage regimen. If they are going to advise, they are going to route of administration, contraindication if they know that. Means while they giving the dosage regimen, they must have to know the contraindication, which of the drug is combined with that of the which of the drug, means drug combination, drug interaction. And if they know, so that is the our pharmacological outcomes. In that basis, describe the common, then these are the advise the dosage regimen, route of administration, contraindication to the patient, doctor, or while discussing with that of the healthcare professional. Now, fourth point is to describe the common adverse drug reaction. Yes, at least they must have to know the common adverse effect while prescribing or while specifically from the pharmacy or from the drugstore, while dispensing, while compounding the things, then in that situation, the pharmacy must have no adverse. In the pharmacological orientation, the chapter 1, that is the general pharmacology, which is given as far as our syllabus is concerned. You can gone through that of the syllabus also. Some of the points we are highlighting, points we are discussing over here, because the complete syllabus, but whatever the important things I am going to highlight it. Okay, so these are the total 10 hours given over here. Okay, in the general pharmacological topic, you need to adjust our hours in complete total 10 hours, including your assessment period also. Okay, so one thing I would like to point out over here, whatever the topic given, you need to add one time for the assessment, for the assessment, or given the assessment to that of the student. Okay, so that is internal assessment, or any kind of the, that uh, that you can decide yourself. Either you have to give the what kind of the unit test, or any kind of by using the technology, or written test, whatever you wanted to give them. Okay, so that assessment period is very very necessary, either oral. Okay, so you can assess orally also, you can assess written also. Okay, so that is up to you, but you have to allow the time to that of the uh, assessment period also. Okay. So introduction and scope of pharmacology, you know that various routes of drug administration, drug absorption. Most probably in the general pharmacology, they have given the 8 topics: drug absorption, bioavailability. Bioavailability is very important. Okay, then drug distribution, biotransformation. Okay, biotransformation, which is related to that of the metabolism specifically. Okay, excretion of the drug, general mechanism of drug action. Okay, so and these are the factors also. Whatever the factors with respect to that of the absorption, distribution, metabolism, excretion. So that is to be going to be discussed with respect to that of the topic mentioned over here. And overall sense, when we are talking about the 1 hour for each topic, and somehow when there is a number of factors with respect to that of this particular topics, then you have to give them a 15 minutes more, and 30 minutes or more, if you require 1 hour, according to that, add the hours for the assessment, for the judging, for the evaluating your student, that they have understanding what you have explaining in the while delivering the lectures, while delivering the topics, right? So that is our main intention. If you are not understanding this formative assessment, you can do it. Okay, so that is very very important. Then we are talking about the drug acting on the peripheral nervous system. Chapter 2 they have given steps involved in neurohumoral transmission. You can say that. You can see over here the diagrammatic representation, which is completely related to that of the neurohumoral transmission. I am not here to tell you that the concept, or you are not a student, so I am not explaining you, but you can understand the things whatever in front of you. So this is the neurohumoral transmission in short, and through that diagrammatic representation, audio, visuals, or your PowerPoint presentation, you must have to give them a such kind of the diagrammatic representation in a stepwise manner, so that they can understand the things. Okay, then this total chapter, then in that you have to definition, classification, pharmacological action, indication, and contraindication. So that is going to be mug up. ये इसके बाद में हम लोगों को ये चीज समझ में रखनी है कि फार्माकोलॉजी में क्या देखने का है. तो फार्माकोलॉजी में डेफिनेशन है, क्लासिफिकेशन है, फार्माकोलॉजिकल एक्शन है, डोज है, इंडिकेशन है. अगर सही मायने में देखा जाए तो इस चीज को समझने के लिए फार्माकोलॉजी कितना महत्व का है, अगर ये चीज हमारे फार्मेसी के बच्चे को मालूम नहीं है और फार्मेसी से करिकुलम से फार्मेसी के डिप्लोमा इन फार्मेसी के करिकुलम से अगर फार्माकोलॉजी को हटा दिया जाए तो क्या वो रियल फार्मासिस्ट बन सकता है? क्या वो सही तरह से हेल्थ केयर प्रोफेशनल करके एक्टिंग कर सकता है, रोल प्ले कर सकता है फॉर द सोसाइटी, फॉर द कम्युनिटी? Either they are going to participate in the discussion of the healthcare team. No. When you are thinking about that, your answer said that it is no. No, they are not. They will not going to participate. He is not, or any of the participant is not going to participate because they don't know the actually the classification class of the drug, for what of the diseases, which kind of the class is necessary. They don't know the indication. They don't know the dose. And mostly, majorly what happened while discussing with that of the pharmacist into that of the group discussion, while giving the proper prescription or while giving the proper treatment to that of the patient, what the doctors and other healthcare persons are expected from the pharmacist, what are the patients are expecting from the pharmacist? These are the things. They know that. They believe on you. And once you are providing such kind of the knowledge to that of the pharmacist, then and then only they can serve the society. They can serve the community. At least they know the classification. We don't want, that the major physiology expected from that of the, because research oriented physiology from that of the diploma in pharmacy student. No. Even the patient is not expected. Even the any of the doctors is not expected. Nurses is not expected. Healthcare team is not expected. So on that day, you have to tell them, you have to teach them, you have to deliver them your content. So you know that the cholinergic drug, anticholinergic drug, adrenergic drug, anti-adrenergic drugs, neuromuscular blocking agent, drugs used in myasthenia gravis, local anesthetic agent, non-steroidal anti-inflammatory drug. Okay, these are the drugs. These are the classification. You all are aware about that as you are the pharmacologist. Or those you are not a pharmacology, because you are from the pharmacy profession or a pharmacy professional, you know that. Okay, and see, one thing I would like to point out over here, I will have the reference list with me after the completion of this chapter-wise discussion. I will tell you mostly the reference list in front of you so that you can understand the things whichever we are going to teach to the student, what are the books, you can use it for the same, or what are the sites, from that we can get all the data in short, or authentic data as well as the updated data. Okay. You know that they are again the drugs acting on the eye. Okay. So in the eye, mitotic, mydriatic, drugs used in glaucoma. You all are known about that. Pupil get constricted, mitotic, mydriatic, dilatation of the pupil on glaucoma angle. You all are aware about the abnormality. So this is nothing but but with respect to that topics, we also know about, we have to tell them to that of the students about their definition. Yes, always definition is very important. Apan काय करतो, what we have done, we are not always define anything. So before starting any of the things, you must have to be defined. Basic concept. So define definition or a terminology with respect to that of the topic is very, very important. I am always give the importance to that of the terminology and a basic concept. Terminology specific. Once we know the terminology, they can understand the concept. They can understand their mechanism of action, their functions. their mechanism of action. When, if we are going to define the terminology properly, you can tell them sometimes in a local language. Give them an example. Doda gya, Marathit sangto, you can pick up the eye, dilate it, constrict it, or you can take the model. Okay. So tell them that's why the importance of the practical. That's why the practical hours are increases into that of the curriculum. Because students are understanding the practical things more. But one thing I would like to say over here that हम स्टूडेंट्स को प्रैक्टिकल पढ़ाएंगे, प्रैक्टिकल पढ़ाना है, प्रैक्टिकल वे से समझाना है, डेमोन्स्ट्रेट करना है हर चीज को. If not the laboratory available in our practical syllabus, already tell them that the simulated virtually online and whatever the things available with us, audio, visual, okay, we are trying to give them. But one thing, practical curriculum में practical हा curriculum मध्ये वाढवला जरूर. They have increases the practicals in the curriculum, but in a don't use the practical approach while teaching. Use all the three approaches: cognitive, psychomotor, and affective domain while teaching, while giving the theoretical as well as the practical knowledge. Once if you are with these three concepts, specifically आपण practical concept थोडा आपण त्याला अफेक्टिव्ह मध्ये इमोशनल पद्धतीने शिकू तर तो लवकर समजून जाईल, हे मला सांगायचं आहे. सायकोमोटर डोमेन त्याच्यामध्ये इनकॉर्पोरेट हँड्स ऑन ट्रेनिंग येणार आहे. तुम्ही लॅबोरेटरी मध्ये त्यांना हँड्स ऑन ट्रेनिंग द्या, नो डाउट यू मस्ट हॅव टू गिव्ह देम हँड्स ऑन ट्रेनिंग इन द लॅबोरेटरी, but that is not sufficient because once they are practically into the field, they will going to learn it by their own once you know the basic things behind that. So you must have to be incorporate the practical things for the practicals, not in the human beings. असं नका करू की सगळ्यांमध्ये आपण अरे प्रॅक्टिकल बनायचा आहे बाबा, प्रॅक्टिकल शिकायचा आहे बाबा. अरे प्रॅक्टिकल करता करता माणूस एवढा प्रॅक्टिकल बनून चाललेला आहे की त्याच्यामधल्या इमोशन्सच गायब होत चाललेला आहे ना. डोंट लिव्ह युअर इमोशन्स, अदरवाइज द ह्युमॅनिटी गोइंग टू बी, माणूस की निघून जाईल. इथिकल, लीगल प्रोफेशन या सगळ्या गोष्टी त्यातून निघून जाईल. जर तुम्हाला इथिकल, वन्स वी वांट टू, यू हॅव टू डू द ethical practices, then you must have to incorporate the emotional things with that of the practical knowledge. Keep this in your mind. कारण जग एवढं प्रॅक्टिकल होत चाललेलं आहे की माणसातली माणुसकी विसरायला नको. विद्यार्थ्यांमध्ये या व्हॅल्यूजला, या इथिक्सला महत्व द्यायचं आहे, तरच तो खऱ्या अर्थाने you know that they will going to serve the nations, they will going to serve the society, and healthcare is a very serving profession. Pharmacist is a very serving profession. When they are use their ethics, when they are use their real values, professional ethics as well as the personal values. थोडासा सब्जेक्टला हटलो होतो पण तो फार महत्वाचा आहे म्हणून सांगितला. तुम्ही ऍग्री आहे की नाही ऍग्री आहे याच्यावर तुम्ही यस म्हणू शकता. ओके, कारण याशिवाय उपाय नाही. राइट, yes. Then drug acting on central nervous system, you can see that. Okay, so definition, classification, pharmacological action, 8 hours are given for that. I already told you that hours wise classification in your hand and you can plan it accordingly. Okay, That is your independence as far as your student is concerned, your subject is concerned, your knowledge is concerned. Okay, so you are having the freedom. I am not going to put up in front of you, but just 8 hours is given for that. And you have to complete this particular chapter in this particular 8 hours, so that we can justify the hours, whatever given, justify the hours as far as the different chapters are concerned. We must have to be time bound. Drugs acting on cardiovascular system. Okay. And yes, I have seen some of the questions in my chat box. I will definitely going to answer it. Don't worry. Okay. Just I have to finish it with that of this particular things, whatever in the curriculum, in a very short, and then we will going to discuss, my dear respected participant. Okay. Drugs acting on the cardiovascular system. Anti-hypertensive drug, anti-angina drug, anti-arrhythmic drug, drug used in atherosclerosis, cognitive heart failure, drug therapy for shock. Okay, you have to cover it everything. No, don't left it anything, but you have to cover within a 4 hours. Okay, in pharmacology we know that when we are talking about anti-hypertensive, anti-angina, because you are some up from the M.Pharm up to the M.Pharm, some are the PhD, and they know that the very well depth of this particular topic. So don't go into the depth. First of all, understand the audience. These are the audience of diploma in pharmacy. Okay. So use your knowledge in such a way so that they can understand. I am highlighting many times the same point. Why? Because न्यू अशी टाकायची असते की त्यातून तो गोष्टी विद्यार्थ्यांना समजल्या पाहिजे. You have to give them fundamentals in such a way that they can understand, they can strong their subject, they can create their interest specifically. जर एखाद्या विद्यार्थ्याला, if any of the students they get understand the things, they clear the things, they clear the concept in his mind, then they are creating the interest, and then they are using their brains, then they are using their real talent, then they are reproducing the ideas. Because while teaching, my dear respected teachers, we must have to be understanding the behavioral concept of the students or learners, students, how they get learns. Okay, so that is, you just keep this thing in your mind. Drugs acting on the respiratory system, bronchodilator, expectorants, antitussive agents, mycolytic agent. Okay, you all are knows that. Then drug acting on gastrointestinal tract. Okay, anti-ulcer drug, anti-emetics, laxative and purgative. Okay, you can see in the curriculum also. I am not going to highlighting much more because we already have the, I don't know how much time remain in my hand. Aditya sir. Okay, we will continue. Nobody is there. जब तक हमको कोई रोकेगा नहीं, तब तक हम लोग चलते रहेंगे. Okay, so these are the some of the points. Okay, now we will move on to that of the autophytes, biologicals. You know that biological is very important topics which is incorporated into that of the pharmacological course. I think that you know that biologicals means which is from the biological origin, living from the made up from the living organism. Okay, that vaccination, immunomodulators, many of the things included into that. So these are the biologicals, their definition, types, indication, biological agents with examples. So you have to define it, explain the types and indications of biological agent. Don't give the much more details of the biological, even autophytes. Okay, as far as the time is given, hormones are very, very important, physiological and pathological. Okay, here both way you have to give them a guideline to that of the student. what I what I see, some of the questions, yes, practicals, how can cover, okay. तर आपण काही क्वेश्चन घेऊच या, आता संपतच आलेला आहे. We have definitely on to that of the subject. Chemotherapeutic agents, penicillin, cephalosporin, aminoglycoside, fluoroquinolones. This is all again the definition, classification, pharmacological actions, dose, indications, okay, contraindications. Yes, this is very important as far as you all are aware about that, but still I am reproducing in front of you. These are the books which will be definitely helpful for you. Okay, these are the reference book list. You can observe it, read it out, or you can take a snapshot of these things. Okay, Pharma Satostar B. Suresh textbook of pharmacology. This is, as far as my opinion is concerned, and most of the topic which is very nicely covered into that of this particular reference book. Then S.K. Kulkarni for the practical pharmacology and clinical pharmacy. Then H.K. Sharma, principle of pharmacology. Okay, these are all the references. Various drugs information books like British National Formulary. These are again very, these are above are the books. Triparty, KD Essential, you know that. Lippincott for the illustrated pharmacology. It is very fantastic book. Huh? You can take the notes out of that and make your own note in easy language so that student can understand. And various drug information books like British National Formulary, MIMS, SIMS, Drug Today, you have to refer it for their updates. I already told you update is very essential. WHO, World Health Organization, they already given us an idea and latest update regarding any of the things, any of the topic, any of the systems. Then NIH website, national websites. Okay, sorry. Now guidelines about the conduct of theory examination. Okay, just have a patience. Somehow we need to understand this about the conduct of theory examination, which is very, very important as far as the examination point of view, evaluation point of view, assessment point of view, and overall year, academic year, how to assess the students. As far as Maharashtra State Board of Technical Education or the syllabus is concerned, Pharmacy Council of India has given such kind of the guidelines for conducting the theory examination. You know that there is a sessional examination, previously also the sessional examination. Here the sessional examination or internal assessment, 2 or more you can take it. Okay, generally you have to take the highest aggregate of these 2 sessional examination, and the duration of the examination of this sessional is 90 minutes, means 1.5 hours. Okay, previously, means when we are trying to compare with that of the previous syllabus as far as year 91 is concerned, they have given 1 hour for that, 20 marks for the same. But here what are somehow different, you can see over here duration is different. Okay, the scheme you can see that the long answers and scheme you have to utilize as it is. Okay, and which is really helpful for the students, helpful for us, and helpful for getting the students to understand the things and the sub course. Okay, I'm not using the word subject. So long answers, answer 3 out of 4, short, that is of 15 marks. Each question carries 3 marks. Okay, each question carries 5 marks. Sorry. Then short answers 5 out of 6, means you have to give the 6 question, and student at least have to write the 5 answers. Okay, in first long answers you have to give the 4 long answers, and student at least write the 3 answers. Okay, and they have the the marking scheme. Then in third question, objective type of the answers. Objective type of answers are answers all 10 out of 10. There is no another alternative or option. Keep this thing in your mind. MCQ you can use it, multiple choice question. Fill in the blanks for this question, or a one word or a one sentence question for this 1 marks question. Means this objective type question must have a 10 question, 10 out of 10. Student have to write down the answers, and each question carries 1 marks. Okay, so total scheme they have given is of 40 marks. Okay, these 40 marks means for 15 marks for first answer questions, second question 15, third question 10, and total 40 marks scheme. But these 40 marks will be converted into that of the 20 marks. 40 marks will be converted into that of the 20 marks. Means how they get reduced. Okay, so totally we need to reduce of 40 is going to be reduced into 20 in each session. Okay, so if any of the student has getting or will getting the 40 mark out of 40 marks, suppose they have the 40, so out of 20 they have the 20. Okay, so according to you have to reduce it your marks. Okay, final board. In the final examination there is a again the university examination, or you can say that board examination. When we are talking about Maharashtra State Board of Technical Education, there is a board. So duration is 3 hours. So final examination is according to that. Long answer, short answer, and objective type. Type of the answer is same. Type of the answer is same that of the sessional examination. Okay, you know that, and only the difference in the marks. Okay, so long answer 7 out of at least 6 must have to write by the students. Short answers 11, 10 should have to be write by the student. Objective type on question answers 20. So 30, 30, 20, total 80 marks. Each question carries 5 marks for the long answer, short answer 3 marks, and 1 mark for the objective type questions. So total 80 marks, okay, in the final examination. Then guideline for the practical examination, which is very, very important. Sessional examination, internal assessment, again 2 or more. 2 या उससे ज्यादा सेशनल एग्जामिनेशन हो सकती है. हाईएस्ट एग्रीगेट जो 2 में बेस्ट परफॉर्म है उसमें से लेने का, हाईएस्ट एग्रीगेट में लेने का है 2 परफॉर्मेंस में. ड्यूरेशन 3 hours, always 3 hours, kept 3 hours, though it is in the sessional examination, it will be similar like that of the final examination for the practice of the student. And they have, I thought so, they have given the 3 hours for the sessional examination, similar that of the final examination, so that student can get practice previously. And it is very good thing what I thought as far as my opinion is concerned, which is incorporated in the curriculum, so that student can have the understanding of the final examination, and they don't they will not going to feel that in the final examination we are facing something new. Okay, so that's why the same kind of the concept which is given over here. So synopsis 10 mark, experiment 50 marks, viva was 10 mark, practical record 10 marks. So totally 80 marks. Okay, in the practical sessional examination of the pharmacology. Okay, and you know that these marks for the experiment shall be divided into the various categories, and that categories are major experiment, minor experiment. Okay, then spotters also included into that as the requirement of the course. Okay, this is that this is regarding the practical examination, sessional examination, 80 marks. In the 80 marks, 50 marks for the experiment, and experiment is divided into 3 parts, that is major, minor, and spotter. Then in the assessment, sessional examination assessment, that 80 marks is going to be reduced into the 10 marks, okay, in each sessional. Actual, as far as our syllabus is concerned, okay, that based of the averages of the 10 marks from the sessional, and 10 marks shall be awarded as per as the detail given below. Actual performance in sessional examination 10 marks, and assignment mark is average of 3. We know that in our syllabus there is a 3 assignment for each student. In our pharmacological curriculum is concerned, they have given the only assignment. They have not given the field visit. Okay, keep this thing in your mind, and you have to assign average 3 assignment to every students in each sessional concept is concerned. In first sessional, 1 assignment. In during the period of second sessional, 2nd assignment. During the period of third sessional, 3rd assignment. With this regards, they are considering while giving the assignment to that of the students. So every student, they get assigned the 3 assignment, they have to submit the assignment, and which will be calculated, which will be given the 10 marks in each assignment, and ultimately the average of 10 marks, which is to be merged with that of the 10 marks of the sessional examination, which is out of 80 going to be reduced into the 10. So 10 that and 10 assignment mark, total the 20 internal practical assessment mark. Okay, so 20 is the theory practical internal assessment, and 20 is the practical assessment, okay, which is as per as the categorization given in front of you. Okay, so if you are having any question regarding that, you can discuss it later on. Okay, after the completion, we will have somehow time. Okay, then final examination similarly, but only the experiment over here is the 60 mark, and the synopsis 10 mark, viva was 10 mark, and the experiment consists of the major, minor, and spotter. Okay, and here is not going to reduce anything. 80 out of 80, right? Then is as far as some of the pharmacological practical is concerned, the course is provided basic understanding about the uses, mechanism of action, dose dependent responses, drugs in simulated virtual animal model, and experimental condition. Somehow in a previous previous curriculum or syllabus, they have given the that board CD, the Maharashtra State Board of Technical Education given us a practical, for the practical they have given the CD, and we are run it for the students for the different responses and different mitotic effect, or any of the effect or other, many of the effect we can say that as far as the practicals are concerned. Okay, so here also the same. Then course objective of this particular pharmacology is the study of pharmacological effect of drugs like local anesthetic, mitotic, and mitotic and rapid. Okay, means we must have to understand the local anesthetics, which I already told you in the form of simulated. We can given this that experimental effect to that of this objective, and similar kind of the experiment is included in the list of the experiment also. Okay, the study of pharmacological effect of drugs like local anesthetic, mydriatic and mydriatic on rabbit eye, screening the effect of various drugs acting in the central nervous system, study of drugs effect on isolated organs, study of pyrogen testing on rabbit. Okay, see, for that purpose, even the course outcome, just have to gone through that. I am not going to read it right now. Yes, perform the effect. Given some third outcome is that perform the effect of given tissues simulated on the isolated organ and tissue and interpret the result. Okay, so majorly most of the experiment we will have onto the simulated and virtually. Some of the experiment like studies of different laboratory animals, okay, or different instrument, pharmacological instrument, which is required in the pharmacological lab, that is actophotometer, poles climbing apparatus, okay, elevated plasmase, or any of the different pharmacological organ bath, okay. So these are the different experimental pharmacological apparatus which is necessary to perform the experiment or perform the behavioral pharmacology, to perform the demo or demonstration for the students. Okay, and even the metabolic cage, animal cage, you can see, you know, all that things. Okay, and these, you know, that for that experimental pharmacology, XPharm series, this is a computerized assistant learning package containing various programs, which is simulated animal experiment in the pharmacology. You can note it down. Experimental pharmacology, how it will be performed, how it will be looking like. Okay, when once you have gone this XPharma series or XPhysio series, there is a number of experiment, whatever mentioned into that of our, you know, that the pharmacology practicals. These are all the practicals are into that of the particular experimental pharmacology XPharm series. This is the one kind of the software. Similarly, like that of the, or more than the, better than that of the previous MSBT software. Okay, I cannot compare it, but I am just telling to you, you can use it the previous MSBT syllabus for the sum of the experiment also, or and you can tell virtually tell them to the student how to practical is going on, how to administer the dose, how to get the responses, how to get the effect. Okay, you can practically explain, and once you have take that XPharma like of the series or physio series, you can simulate it form of the experiment, you can show to that of your students, and betterly they can understand, definitely. And basically, if you are starting the pharmacological practical, you must have to give them two experiment very effectively. That is, noted that the laboratory animals as well as the laboratory equipment, pharmacology laboratory equipment and pharmacological experimental animal. Okay, and models. What are the different models? Some likewise for the any of the suppose mydriatic effect, mitotic effect, central nervous system. Okay, central nervous system. What are anxiety? Suppose model. So for that purpose, what are we are going to use actophotometer or any of the other you know that the instrument or number of the you know the models which is given into that of the particular such kind of the software, as well as the research. You can go through that of the number of research articles for getting the models, but you have to give them a basic idea to the student, okay, and so that they can understand the practical knowledge of the pharmacology. I thought this is the end of the you know that the pharmacological orientation, whatever what I thought, which is in front of you, put it. Okay, and see, you can say that the assignment topic as far as the syllabus is concerned, that and every students, you have to give the 3 assignment as per as our curriculum is concerned. Okay, हमारे curriculum में जिस तरह से बताया है कि 3 एक assignment पर हर एक student को देने हैं, उसके topic भी दिए हुए हैं, कौन से topic पे mostly हम लोग उनको assignment देना चाहिए, which topic which we will going to prefer for giving the assignment to that of the student. Okay, so that they will earn the 10 marks, and even through that they can understand the practical knowledge. Okay, don't you know that these are the creative slot. Here the student can create something by their own mind. You are the mentors, real mentors and real guide in that particular assignment, so that they can understand the importance of the problem based learning as well as the project based learning, and they understand the research project or any of the project through that of the assignment. And that's why the assignment is very, very important. Tell them to write it on that particular topic. Tell them to, you know, that survey. Tell them to do the little bit depth. You have to guide it, right? Likewise, or you have to make it a evaluation scheme to evaluate the assignment. Better to make a scheme also sometimes. How it will be evaluated? Like a pharmacy training part 3. You can evaluate this assignment also. You can give them a chance to the students. With the help of this assignment, they can represent their assignment in the form of the PPT. Oral presentation, you can do it for the students. Why this particular assignment is assigned into that of the curriculum? What are the major advantage of that? So that the practical understanding of this particular subject is going to be increases through that of the assignment, because theory and practicals are the you know that are included into that, but assignment is what? Why assignment? So that is the utility of the assignment, and more towards the practical, more towards the demonstrating hand, more towards the hands-on training, more towards the creativity, more towards the understanding of the particular concept of the pharmacology. And that's why these are the assignment, my dear participants, respected participants, for this into the pharmacological assignment, into the pharmacological course. So, thank you very much for your patience here.
Thank you so much,
I
sir.
don't think so. If you are having any question, you can ask me, or this is the presentation, and that's all from my side. And if you are having any question, you can ask to me. I'm trying my best level, and if you are having any question,
yeah,
yes,
thank you. Thank you so much, sir. Yeah, I would like to put some point into the audience that sir wasn't well in last week. Okay, so he was sick since last week, but he managed to find out some time with us, and I really thank him for being on board with us. Thank you, Dr. Vivek sir. Thank you so much for being present here. So we will move ahead with the questions. I'll just take some questions which are there in chat box. The first question is there, sir.
Yeah. I already gone through that.
Yeah.
Just I will one by one we will take it. Very informative.
Sure.
Okay.
Sure.
How to conduct practical exam by using old exam software or question and type. See, you can go through that first of all. Old some of the experiments are similar with that of the previous curriculum is concerned. Okay, so you have to first of all, I'm not going to teach you anything. I'm just telling to clear your concept in your mind, that compare your previous curriculum and this new curriculum, and see that what are the similar experiment into that of the first one and this one. And this similar experiment, you can go through that and utilize this particular software, MSBT software, for demonstrating that particular similar kind of the experiment for the student. Okay. Now, then how to conduct practical exams? Which drug information should be taken in category of drugs, as there are more drugs classified in. Yes. Yeah, this is the question. Yeah, which drugs information should be taken in categories of drugs? As there are more drugs classified in specific category. No. See, which drug, that classification basic means generalized classification with respect to that of the drug, you can tell them to the student, even the latest update also. Okay, you can categorize the you cannot I already told you there should be some specificity, but that means याचा इसका अर्थ ये नहीं है कि उसको आप ऐसा करो कि उसको कुछ नए चीजें बताओ मत, ऐसा नहीं होता है। तो आपको वो चीज बतानी है, उसको स्पेसिफाइड कैटेगरी में जो है वो तो कैटेगरी बतानी है, और नया कुछ है वो भी बताने का है। That is for their knowledge, but you have to time bound, you have to match your times, okay, as per as your time is given into the curriculum.
Yeah, there is one more participant, sir. So I'll just ask, unmute her. Mr. Varsha.
Yes, is it okay to conduct the regular practical? Yes. You are okay with that of the old CD. Somebody asking to me that, is it okay to conduct the regular practical from? Yes, you can do it. But if you are having the specifically mentioned Pharma X, that I already X Pharma series of practicals, you can pick up it, you can buy it by your institution. That is very nice, so that the simulated form is somehow now I have too much of time. I already, if you just go through that in that particular that site, and you will get all the information, XPharm and XPhysio, and even some of the demo type of simulated experiments are mentioned over there, and you can easily observe it. Right. Hello. Right. Question. Yeah. In the practical exam, how the distribute major experiment 50 marks? Because in MSBT practical exam, CD only 6 questions are there. No. See, here you cannot see. Similarly, you can pick up the questions from that of the MSBT CD. No, whatever the practicals we will have to given to that of the in the examination, which is for the completely new syllabus. Okay, we have to use it the CD of previous syllabus only for the demo purpose for the students. PC2 is lack in syllabus. Okay, that is your opinion, Aarti Sonone madam. That may be right. I am not going to say that this syllabus is completely 100% is covering everything. No. See, whatever the requirement as far as the diploma in pharmacy is concerned, they have given that. Some are the repetition, some are the similar things, but that is related to that of the pharmaceutical sciences and which is needed for the diploma in pharmacy. Change means what? Change means we cannot put anything which is, though it is a new, but it is not related to that of the diploma, then we cannot incorporate, right? So maybe some of the things we need to be still discuss, and we can convey to the Pharmacy Council of India. Together we can work on that, and we will convey to them so that they can understand. Our expertise will convey to them.
Yeah, I guess that should conclude the session, because I guess we have lined up another session with us, sir. So shall we conclude, sir?
See, Aditya sir.
Yeah.
I am so many of the things in my mind is going on right now, because I am really, but because of time consent, even while giving the answer, no number of clubbing is there, because time is going on. I already take the 25 minutes more, and we have delay something 10 minutes because of their network problem. That is not completely my problem.
No, not at all, sir. Not at all.
Yes, thank you very much.
But we are glad to have you here, sir. So thank you. So to all the participants, that concludes our session 1 for the day regarding pharmacology, orientation on pharmacology. For the second session, I'm glad to welcome two of our very what do you say, known faculties around here. So that's orientation on community pharmacy. Can I stop your presentation, sir?
Yes.
Yeah. So I really I would like to welcome Dr. Remeth Dias, sir. So who is the head of department. So he has graduated in 1996 and completed his B.Pharm in 2002 and PhD in 2008 from Government College of Pharmacy, Karad. Am I audible, sir? Dias, sir? Hello? Dias, sir? Just a minute.
Yes, sir.
Oh, yeah. Thank you, sir. So I was just checking that your mic is there or not. Am I audible to you now? So he has also completed his MBA and postgraduate diploma in patent laws, DYSA. He started his career as MR in Hochst Marion Rossell at Kolhapur. After his 2 years in the MR field, he shifted to academics and he is having 23 plus years of teaching experience. He worked for 4 years with MES College of Pharmacy, Chiplun. Then he worked for Satara College of Pharmacy, Satara for 9 years and developed the institute from its inception. He has worked as professor at Sinhagad Institute of Pharmaceutical Sciences, Lonavala, before shifting to the Yashoda Technical Campus as campus director for 5 years. Presently, he is working as head of department at Government College of Pharmacy, Karad. Before that, he, as we all know, that he was there at Government Polytechnic, Jalgaon also as HOD only. So he has authored 4 books, published 23 international and 51 national research papers. He has guided 44 plus MPharm students, 1 PhD student at his area of interest includes biopharmaceutics and pharmacokinetics, NDDS, biostatistics, and DOE. He is a life member of various professional bodies. He has also won the APTI Best Teacher Principal of Diploma Pharmacy for year 2018 during APTI Convention at Jaipur. He has delivered more than 110 expert lectures on various topics and trained more than 5,000 faculties on online teaching through various FDPs. He has worked as member of Board of Studies in Pune, Solapur, Nanded, and Kolhapur universities. He is certified CMI Management Institute from UK and Level 5 Certificate Management and Leadership. And it's very I'm very glad to have you here on board with us, sir. Sir will be taking the community pharmacy and management theoretical part, and whereas the practical part will be taken by one of the more well-known community pharmacists in India, Mr. Rajvaidya sir. Rajvaidya sir, am I audible to you?
Yes, very much.
Yeah,
thank you.
Yeah, thank you. So here we have with us Mr. Rajvaidya sir. He is a chief pharmacist and partner in Hindu Pharmacy at Panji, Goa. Since 1989, it's a family-owned business for him. So it's very as with Dias sir, the CV is so long. I may miss few points, but it's glad to have we are glad to have you here with us, sir. So he was a vice president and chairperson of Community Pharmacy Division of Indian Pharmaceutical Association during 2006 to 2012 period, and he was honorary secretary from 2002 to 2004. So he held various positions as secretary, treasurer, executive committee member in IPA Goa State Branch. He was vice president of Goa State Pharmacy Council during 2013 to 2018 part. He is the president of Alumni Association of Goa Pharmacy College, College of Pharmacy, from 2019 to 2023. His term will be ending in 2023. He was editor of IPS CPT's E-Times official bi-monthly, and since currently he is the editor in that IPS CPT's E-Times and core team member since 2012. So he has headed many of the projects. One of the project lead, he was there for pilot project on accreditation of pharmacies in India. So that, which was IPA initiative in collaboration of DCGI of India and WHO for Indian country office in 2007 and 2008. So he has been very much part of most of the things which are there around in pharmacy. Rather, may it be a community thing, may it be a professional thing, he was there and he is there still contributing to the pharmacy community. There are many awards that he has won. He is Young Achievers Award by IPA in 2005. 2005 he has won that. He has also won the Hero for Health Award of South Asia by FIP in 2006. He has won the IPA Fellowship Award by IPA in 2007. Frank Tong Memorial Ceremony Award, which has been given to him for contribution to public health by Voluntary Health Association of India in 2015. He has been instrumental in developing the syllabus. I must mention that he is one of the person who has been very instrumental in developing the Education Regulation 2020 that we are discussing right now. He has been working into the other professional bodies also, and he has authored and co-authored many books also. So we are glad to hear with us, sir. So it's been our pleasure, Raj Vaidya sir. Thank you, sir.
Thank you.
Yeah. So we'll start with Dias sir with the theory part, I guess, and then we'll continue to Raj Vaidya sir for the practical part. Over to you, sir. Dias sir, over to you.
Aditya.
Yeah.
Yeah, I have joined from my computer. Let you allow me to unmute.
Sure. Sorry. Just a minute. Yeah, sir.
Yeah, thank you. So, good morning, dear learners. It's very exhilarating to be with you once again this year for second year diploma pharmacy orientation. And I am very much exhilarated because of another reason, that Mr. Raj Vaidya sir is with us. And before going to Raj Vaidya sir, let me first say a big thank you to Dr. Rakesh Somani sir, Aditya Bhuge sir, and all the team who has taken these pains and started this orientation program for 2 days for we teachers. After having a big thank you for them, let me come towards Raj Vaidya sir. I'm speaking before him, but let me tell you, he is the hero of community pharmacy in India. And he is on this platform to interact with we teachers. Because Manjiri Gharat madam, who is presently the chairman of Community Pharmacy Division of IPA, and previously Raj Vaidya sir was the chairman of Community Pharmacy Division IPA, and along with Dr. M.D. Burande sir is there, and then Dr. P.V. Narayana, who is holding IPA and all. So there's so many people from Indian Pharmaceutical Association who have taken many pains to upgrade community pharmacy in India. Okay, the pace may be the lower one, but to have Raj Vaidya sir today over here, to have that interaction with us when this community pharmacy and management syllabus has been changed, or that orientation will be a proper one from Raj Vaidya sir. I will be putting some theoretical aspects of community pharmacy, but I would be very much eager to listen Raj Vaidya sir, because he is the one who was instrumental in bringing good pharmacy practices, GPP training manual, and so many things which cannot be told, but we can hear from his mouth only. Okay, so with this, I will just turn to my presentation. So let me share my screen.
Yes, sir, visible now.
Okay, yeah. Okay, dear teacher colleagues, so we will be going for community pharmacy and management, where I will be taking only the theoretical part, and let us discuss what exactly we are going to cover or orient ourselves towards the syllabus that has been given by PCI. But let me tell you, for this CPD, this community pharmacy and management, even Manjuri Garat madam was very instrumental in drafting this syllabus. So her point of opinion will also be good, and even the Raj Vaidya sir is already with us for discussion. So let me give this orientation lecture. So course code, and we'll be talking about this community pharmacy and management orientation lecture for diploma in pharmacy faculty members. And I have kept these learning outcomes. After completion of this session, the learners will be able to review the syllabus framed by PCI under ER 2020, more specifically of the subject community pharmacy and management. We are going to discuss the role of a teacher in implementing this ER 2020, because this is a very important subject which is going to bring a lot of change in our students who will be handling the community pharmacy. Third one is, actually we are not going to design any lesson plan, but we will be thinking of what is expected of us as a teacher in designing this lesson plans for the chapters of community pharmacy and management. And then let us discuss so that we can have some solutions for any doubts which we will be having after this session. Okay, once again, I will come to the professional competencies for DPharm, because we want to see how this community pharmacy and management is going to be mapped with the professional competencies that has been devised for this 2 years course. Okay, so the first one, review the prescription. I'm not going to read this. I will just go for 10 competencies which have been given by Pharmacy Council of India. And I would like you people to go for the mapping of this. Let us go for the first, review the prescription, whether the subject community pharmacy and management is going to be mapped with this first PC, that is professional competency, PC1, review the prescriptions. You can use your chat box and you can just give me the answers. Yeah, is it going to be and how? Yes, it's very clear that review the prescriptions, because already there are few practicals. We will be even going for the theory part where we will be making the student competent to review the prescriptions. So this competency is 100% matching with PC1, that is reviewing the prescriptions. Now comes the second. PC, that is dispense prescription, non-prescription medicines. Yes, I want you to chat with us. I know that this is the time where you might be going ahead for your food and all, but still, let us make it interactive. I want you, yeah, because in the syllabus itself, it is dispensing the prescription and non-prescription medicines. It is there in community pharmacy and management. So 100%, this is also matching or mapping with the CP2, PC2. Okay, that's a professional competency number 2. Provide patient counseling and education. So if you go for the syllabus of community pharmacy, patient counseling, it is there in theory, it is there in practical. We are going to provide the education to the patients, and therefore even PC3 is going to map with this. Now, if you can come to fourth, hospital and community pharmacy management. Once again, the community pharmacy management, the word itself has come. So it is 100% mapping with PC4. Expertise on medications. Yes, without having expertise on medications, we are unable to counsel. Mostly the medications, what to counsel, what points will become. Okay, pharmacology is also, all the subjects are going to map with few of the competencies, but I will say that even the PC5 is going to be mapped with this community pharmacy and management, because we are going to study at least the chronic diseases, their treatment, because that is going to be in the patient counseling which we have to cover. So PC5, yes, 100% mapping is there. Now, proficiency on drugs and pharmaceuticals, I may not go for this mapping. It is because that you can see in detailing that it is regarding the structure and SAR and all that. So we may skip PC6, drugs and pharmaceutical proficiency. Okay, but PC7, once again, entrepreneurship and leadership, whether it is going to be mapped. Yes. Because a student who is going to learn community pharmacy management is going to be an entrepreneur. We are going to tell him how to come up with a community pharmacy, how you are going to establish the pharmacy. We are going to tell how he is going to handle that. So PC7, entrepreneurship and leadership, PC7, 100% mapping, because even you are going to inculcate those leadership qualities into your student during the practicals and theory. It is because a pharmacist is a leader too, and those skills needs to be given to your students. Therefore, PC7 is mapping. PC8, deliver primary and preventive health care. We are going, because you are going to deliver the OTCs, you are going to provide the patient counseling, and therefore much of, because even the there will be health screening tests which you are going to do into your pharmacy. So you are going to deliver primary and preventive health care into your community pharmacy. So PC8 is also mapping. Okay, then comes the professional, ethical and legal practice. Yes, community pharmacy, when you are running it, you are a professional. You have to follow some ethics into your community pharmacy, and legally you are bound with so many, because we have so many acts which we are going to follow it. So professional, ethical and legal practice, PC9 will be totally mapping with this subject, CM, that is community pharmacy and management, CPM. Yeah. and then continuing professional development. While going on, because see, right now also, let me tell you, there is one course which is available on good pharmacy practice on Future Learn, which is maybe free of cost if you're not going for the certificate. So many courses are available online free of cost, which needs to be taken up by the students. 3-week course. Okay, by Taiwan University it is. So why not to go for that? So continuing professional development for the students and for the teachers, this subject is going to give you the opportunity. So I feel if you inculcate that continuing professional development habit into your student during teaching of this syllabus, then yes, this piece is also going to be mapped with it. So let me tell you, this is the subject where most of, I can say that 9 out of 10 professional competencies you are going to deliver to your students when you are going to study this, you are going to teach this subject to your students. And why we are focusing on these professional competencies? Every lesson plan which you are going to create, it should focus on this, keeping into mind that this lecture, what professional competencies out of these 9 I am going to deliver today to the student. So in that case, you should plan and you should deliver, and the student should take it. Therefore, let us not keep this list only for the sake of reading it. Let us focus, let us plan this for every lecture. Let us map it. Which competency I am going to give to my students today. Okay, so 9 competencies will be mapped in any of your lecture which you are going to plan for 75 lectures then in community pharmacy. Okay, now this course is designed to impart basic knowledge and skills to provide pharmaceutical care services. This is very, very important. Whatever the previous syllabus we were having, most of the time, whether we were supposed to deliver this pharmaceutical care services in pharmaceutics too was questionable. Therefore, this subject which has been designed now, it is looking for the pharmaceutical care services, and the whole world as looking from the community pharmacies that the pharmaceutical care services needs to be provided in a pharmacy, in a community pharmacy. And therefore, our scope of this subject is we are going to provide those skills to our students so that they will be able to provide the pharmaceutical care services. Okay, into their community setup. This we should understand the scope of this subject. And course outcomes, you might have already read it, but just we are going ahead. So we should always keep this course outcome in our mind, that what after completion of this course, subject completion, what the students are going to achieve. They should be able to describe the establishment, legal requirements, effective administration of a community pharmacy. They should be able to professionally handle prescriptions and dispense the medications, counsel the patients about the disease, prescription and or non-prescription medicines. And 4, they should be able to perform basic health screening on patients. So these are the 4 course outcomes after completion of this subject, theory as well as practicals. They should be able to do. They should be able to do all these things. Then only we can say that they have done this course well. Okay. Now let us go chapter wise. Okay, so 2 hours have been given to the community pharmacy practice. Okay, so now what needs to be covered? Introduction to community pharmacy, where the faculty members can define what is community pharmacy, what is a retail pharmacy. After community pharmacy is introduced, how the evolution of community pharmacy has taken place, that needs to be discussed. Then you can come to the international scenario presently, because I said pharmaceutical care providing, it is presently being practiced internationally, and what is the national scenario that we have to see. So community pharmacy practice 2 hours have been given to us. So in the first lecture, you can cover what do you mean by community pharmacy, how it has been evolved, maybe from the 19th century or back you can go, but at least from 1920s and ahead, those things needs to be covered. What is the evolution? What is the international scenario and national scenario? That comparison can be taken in the second lecture. So 2 lectures have been divided. So first lecture, you can cover these 2 points. Second lecture, you can cover this international and national scenario. Okay. Now in that only, if you go in community pharmacy, when we are talking about evolution, you can see in the ancient times, the first documented chemical process took place. But there in ancient times, it was the physician who used to prescribe and compound simultaneously. But in 19th century, the physician started to prescribe and pharmacists used to compound. So this is very important. That is the evolution that you should be able to tell to your students. And now when the compounding was the main profession of pharmacies in 20th century, when the mass drug manufacturing started, the work of compounding drastically reduced. And therefore you can see in the today's scenario, it is what patient care has become the main profession of a pharmacist. So how it has been evolved, that you have to take up. Then maybe if you can go in evolution of community pharmacy in America, in England and all that, then you can come across that how it has progressed. Okay, so if you can come up with the first from 1920 to 1949, where the compounding start, in 1920, the mass production started, and slowly the compounding was reduced. So that from 1920 to 1949, this era is called as a soda fountain era, because in a pharmacy, what they were selling, the medical alcohol, the one which can taste like soda, the soda fountain was there, and the people used to come to have that soda in the pharmacy. Therefore, it is called as a soda fountain era. And apart from few of the compounding thing, the lot many of things were sold into the pharmacy. Okay, but it came that in 1950 to 1979, it is lick, stick, and pour era, where you will find that the first time the things started to change. First time the community pharmacy came into existence. Like means it was there, but the activities were other things were sold into this. But here it was the era where it started that only how I am going to counsel the patient. So it is not that. You can see in America, it was in 1950s that PharmD qualification started. Here in 1920s, 3 years pharmacy course was evolved here in 1920s. 3 years course, minimum qualification. In 1950s, PharmD course, but it was only 4 years course. But later when it came into this era of 1980, it became 6-year course in between this period. 6 years course of PharmD. Therefore, it is a pharmaceutical care era. Patient counseling, not only patient counseling, how we are going to do the immunizations and health monitoring and whatever the screening test that can be carried out into the pharmacy. And then came the post-pharmaceutical care era from 2010. Not many of the things have been taken care of apart from dispensing. Okay, so in case of pharmaceutical care, dispensing was there, but now it is not the dispensing, but apart from dispensing, the patient care services are being given. Okay, so that was a drastic change in a pharmacy practice, drastic change in a education also. And what happened in India? Maybe we started late, maybe in 1950s with the DPharm course, but if you can come in present, this one, the still DPharm course is there, but in 2008, we could start with PharmD course. So slow pace, but we are progressing. maybe we are presently doing the dispensing work, but apart from dispensing, pharmaceutical care is our motto. We'll be going to a post-pharmaceutical care era, but it will take time. Now we are in pharmaceutical care, how we can expand, and therefore you can see now even the change in syllabus took place, where through community pharmacy, we are going to see that how the pharmaceutical care can be provided in each and every pharmacy, community pharmacy in India. Okay, so in the national scenario, you can see we have independently owned retail pharmacy. But if you need to give pharmaceutical care, what is the size of our pharmacies, independently owned retail pharmacies? You can see where you are going to do the counseling. Counseling is not happening today. Online pharmacies are also mushrooming where the stringent regulations are not present. We have the corporate pharmacy chains coming. We have a departmental stores in supermarkets also. These are the four things which are present, but we need to change drastically, but slowly we have started. Okay, an independent retail pharmacy, how we can take a patient care. We can listen from Raj Vaidya sir, who is heading Hindu pharmacy in Goa, where he has done so many experiments in taking the pharmaceutical care. Okay, so national scenario. So in first two lectures, you have to cover evolution, what is the international and national scenario of community pharmacy practice. Okay, then comes the second chapter, professional responsibilities of community pharmacists. Maybe I'm not going to go into the details. Only thing is, just we'll discuss the things what needs to be covered, because just a half an hour is with me, because we are going to listen Raj Vaidya sir after me. So professional responsibilities, I don't want to elaborate on that. Okay, we can see there are the 7-star pharmacist model which has been given by FIP long back in 2008 or 7 or 8. Then now 8th one researcher has been added to this. So 8-star pharmacist is there. So what are the responsibilities when we are talking about 7-star pharmacist? Then comes the good pharmacy practices and standard operating procedures. So good pharmacy practices, standard operating procedures, lot of work in India has also been done. I have already read GPP training manual, which was brought in 2005. And I'm fortunate to have that GPP module, training module with me. I don't know whether it is available for sale in with IPA now. If it is there, I would request all the pharmacy colleges to have one copy from IPA regarding GPPs, because this training manual has been very nicely written, and even the standard operating procedures for everything has been given in the annexes. Okay, so GPP training manual that is there. So you are going to cover these things in 2 hours, maybe professional responsibilities and how we can, pharmacist is a 7-star pharmacist. That can be explained in first lectures. In second lecture, we can go for good pharmacy practices and how the standard operating procedures can be followed in the community pharmacy. Okay, so these are the important 4 professional responsibilities. Okay, where you can see first one is dispensing. Okay, not only that, prepare, obtain, store, secure, distribute, administer, dispense, and dispose of medicinal products. This is what the first responsibility is. Second is how medication therapy management can be provided. This is the second responsibility. To maintain and improve professional performance and to contribute to improve effectiveness of the healthcare system and public health. These are the 4 major professional responsibilities which have been introduced by WHO and FIP. Okay, sub responsibilities are very much in details you can go for, but these are the 4 professional responsibilities which we need to focus on. Okay, then GPP. Yeah, let me tell you that this International Federation of Pharmaceutical Organizations, okay, this is FIP, adopted the guidelines of good pharmacy practices in 1993, and this was endorsed by WHO in 1997, and you can see that in 2011 the joint FIP WHO guidelines on GPP have come. In IPA, also has come with the training manual. Okay, and this GPP should be followed, but as it was not in a syllabus, we have never taught this GPP to our students, and this syllabus is going to make us relevant, that we are going to teach the good pharmacy practices which will be practiced by each student in their community pharmacy. So GPP is nothing but the practice of pharmacy that responds to the needs of the people. We should focus on the needs of the people who use the pharmacy services to provide optimal and evidence-based care. That is GPP. Let us not go into the details, but you can find these guidelines available online. All these 2011, 97, and 93 guidelines available online, and even the GPP training manual, if you can take, whole things have been given in details, because GPP guideline tells that every nation should come up with their own GPP guidelines, and it was IPA, CDCSO, WHO India Country Office who took the initiative, and they have come up with GPP guidelines for India. Now, when we talk of GPP, these are the activities which have been 4 activities, those have been focused, and based on that, so many things have been taken. The first one is the promotion of good health. A pharmacist should promote the good health, not only the illness, what is to be done in illness, but how a healthy India will be there. So that is the first responsibility or activity. What activities we are going to do for that? Second, activities are associated with supply and use of medicines. Okay, because it is a pharmacy who has to supply, who has to counsel on the proper use of medicines. And then the third thing is we have to talk about the self-care, because the people are going to come for OTC products. People are going to come for the minor ailments where they will not be going to the doctors. So how you are going to promote the medicines in self-care? And fourth one is the influencing the prescribing and rational use of medicines. These are the 4 important activities which good pharmacy practices are promoting for the pharmacists. Okay. So you are going to talk on this for the 2 chapters you are going to cover regarding the good pharmacy practices. Chapter 2, which is regarding this professional responsibility of community pharmacists. Okay. So chapter 2 is over. Okay. I'm just oriented to you regarding that. Okay. The last part of it is standard operating procedures, where you can see the major, these are nothing but the written protocols and procedures which are to be in place within the pharmacy. These are the SOPs of pharmacy, community pharmacy. Then where we have these 6 important things to be covered. Objective, what is the procedure trying to achieve? Scope, what should the procedure cover? What is the scope of this SOP? The process, the procedure will come, how the task is to be carried out. Who is responsible for this process? That comes the responsibility. Then you are going to train the staff in using these SOPs, and this will be reviewed. So this is, and let me tell you, GPP manual contains all the SOPs, starting from cleaning of a pharmacy, cleaning the refrigerator, to maintain the daily cash records and all those things. So all the SOPs have been already given in training manual of GPP. Okay. This is a sample one which we have taken from NHS, where all these 6 stages have been followed. What needs to be done, that is given in standard operating procedures. Okay. So this is the standard operating procedure for dispensing. Okay. So everybody can create their own SOPs to be implemented in their community pharmacy. Okay, then comes the chapter 3, prescription and prescription handling. Already prescription was there in earlier syllabus. 7 hours are allocated for chapter number 3. So parts of prescription and its legality. Okay, so I don't need to talk on more, but we need to give at least 2 lectures, 2 sessions for this, because first maybe for what are the parts of prescription and its legality, and second, I think if you can come up, take few of the prescriptions from the market and check its legality, that will be good. Then second, handling of prescription. what is the procedure of handling the procedure, that can be covered in one of the session. Then comes the main label, ancillary label, pictograms. Okay, so that can be covered into one of the lectures. Okay, handling of prescription can take 2 lectures. Then main label, ancillary labels, and this one can take pictograms can be taken. And let me tell you, those pictograms are already there on United States Pharmacopoeia. This website is given over here. Okay, so many are there. There are so many other pictograms even in our training manual is also there. These pictograms are there, GPP manual. So, and good dispensing practices. What are the good dispensing practices for that 2 lectures? So maybe 2 lectures for parts of prescription, handling of prescription and main label, maybe 3 lectures, and 2 lectures for good dispensing practices. If you can cover this in 7 hours. Okay, so parts of prescription, how the legality of prescription is there, give the prescription to the students, let them check whether the legality of prescription is there, when they can dispense the prescription, that should be told to them depending upon the legality of prescription. Then handling of prescription, various different steps are there in handling of prescription. Okay, so those you can discuss and even provide the demo that how the prescription can be handled. Then there are the main and auxiliary type of labels which the pharmacist should utilize. So those the one example I have given, that how you can see these are the auxiliary things which has been written, okay, or printed by a pharmacy. Okay, because this this medicine is going to cause, so may cause drowsiness, keep out of the reach of children, shake well before use. These are the ancillary types of labels, or you can say auxiliary types of labels. The main label is this. So like this, you can come up and teach the students how to prepare the main and auxiliary types of labels. Then leaflets are also there, which for the patient education that you can prepare. And then comes the good dispensing practices. This is the flow chart. Okay, maybe in a pharmacy, if we have 2 pharmacists, the person A, that is a pharmacist 1, can receive the prescription. He can screen and process it. If there is the issue, then he has to contact the prescriber and then he has to get back. If there is no issue, then he can go for preparing medicine or getting the medicine. So for that, filling, labeling, and all those things. Then person B is going to record it. Counter checking will be done once again by person A. Likewise, 2 persons are involved so that there may not be any mistake during the, because for a pharmacist, there should be assistant who will do this thing under his guidance so that there will be a good dispensing practice. Okay, you are giving what is good dispensing practice? Right medicine to a right patient at the right time is given. That is the good dispensing practice. So this is a sample flow chart which can be followed in the pharmacy. Okay, so 7 sessions for this chapter. Then comes the 4th chapter, that is the communication skills. Now, we as a pharmacy teacher, we will feel that once again we have to go into English. Yes, we need to. But we should know how to communicate, because our student who is going to be a community pharmacist needs to communicate with the patients. He needs to communicate with the higher authorities like FDAs and doctors and other regulatory authorities. So he should be able to communicate effectively with the patients who are from the rural area, who are from the city area, and even with the regulatory authorities. And therefore, we have to see what are the various types of communications, how the communication can be effective. So 6 hours have been given for this communication skills. So first thing, verbal communication, non-verbal communication. So for verbal communications comes once again oral, visual, and written. This type of 3 types of communication. So I will suppose that maybe for the first 3 lectures, maybe you will be devoting for written, oral, and visual communication. Then maybe you are going to devote 1 lecture for the body language, non-verbal communication, how the non-verbal communication can be given, and the patient interview techniques, because many times patient comes to you, you want to take his interview so that you can know what is his requirement. So how you are going to communicate effectively with the minimum time, because time is a constraint for the pharmacist. So patient interview technique. So likewise, you need to plan your this topic 6 hours for this topic. Okay. So communication, oral and written. So two-way communication it is, where you need to listen properly. Okay. Hear, respond, decipher, all these things will come in the verbal communication skills. And non-verbal for the body language, even the written is very important, because we see that our students are not able to write the application to the principal. Then we have to see how they are going to communicate with the higher authorities. Okay, so even the written communication needs to be taken care of. Okay, then so you will find that 6 hours are roughly given for this. So we have to cover that. Then chapter 5, 10 hours, patient counseling. Patient counseling was not taken so seriously by us, because that was not being there in our earlier syllabus. But MSPC had already taken few along with IPA, and they have taken the initiatives of patient counseling, and patient counseling courses were PCC, patient counseling course, were conducted in Maharashtra, and it has been conducted from 2006 onwards from there, or 2005. From there onwards, they are taking it. Okay, this is CPP PCC courses. Okay, now you can even take few of the video clips of patient counseling from MSPC. They are having it. Okay, so we can even take it from them. We can show it to our students. We can also get trained from them, and then we can implement patient counseling. There are various stages of patient counseling. Some barriers are there to effective counseling. We have to even take the patient counseling points for the chronic diseases. 6 diseases have been covered, and we have to talk on patient package inserts and leaflets. So if you ask me, stages of patient counseling may be covered in one lecture. Barriers to effective counseling may be one lecture. Patient counseling points, 6 diseases, chronic they have given. So this is going to take at least, because patient counseling, not only you are going to cover that disease, but you are going to train your students for the patient counseling points. The practicals are also there. Side by side, you can take the practicals also. But patient counseling point, you can devote the 6 lectures minimum for them. And then you can go for the package inserts, because even the pharmacists are not reading the package inserts. But package inserts, so much information is given, which you can give it to your patients. So apart from leaflets can also be, few of the companies are coming with leaflets. You can even print your leaflets for your pharmacy. So patient package inserts and leaflets, maybe 1 or 2 lectures, 6 lectures for patient counseling points, and remaining lectures for stages and barriers of effective counseling. So 10 lectures you can cover for this patient counseling. Okay. So stages of patient counseling, I will just run through the slides now, because we are taking much of the time. So preparing, opening, actual counseling session, and closing the session. So how we can do it? Those stages needs to be explained in the lecture, which will be covered in details in the practical. See, during the practical hours, we are going to have a model pharmacy. Therefore, whatever the practical you are going to take, so there the students needs to one-to-one, they need to be able to counsel. Because just to write an answer is not okay. In the practical, they need to one by one. Therefore, you have to make the teams and let them counsel the 6 diseases. Okay. Now, barriers. There may be the barriers of a system, barriers in pharmacist. If his communication is not good, there will be a barrier. There are so many other barriers. Patient barriers, because many times patient doesn't want to discuss with you. That is one of the barriers. System barrier, no place to counsel. That is a system barrier. So there are so many barriers, but mostly there may be system barriers, there may be the patient barriers, or there may be the pharmacist barriers, which you need to cover during your session. Then comes the patient counseling points. We don't have time, or otherwise I would have asked you the questions regarding this, because the first one, the disease which has been given is of hypertension. So what patient counseling points? You need to cover the disease, the whole. What do you mean by hypertension? Mild, moderate, severe, all that classification. So what are the causes? What are the symptoms of this hypertension? What lifestyle modifications you are going to do? What medications you are going to give? And what you are going to suggest to the patient if there is acute and chronic complications. So all these counseling points needs to be covered by you during your session. Okay, regarding hypertension. Then comes the diabetes. Then comes the asthma. Okay, so patient counseling points should depend upon the disease, what lifestyle modifications, starting from exercise, diet, and other remedies you have to talk about. Then comes the medications, how to use the medications. Some tests are there, how to check it at home only, maybe for diabetes, how to use glucometer, those things will come. Okay, so all these things needs to be covered for each and every 6 diseases. Okay, so you have TB, you have chronic obstructive pulmonary disease and AIDS. Okay, so these 6 diseases needs to be covered in details, not only in theory but also in practicals. Okay, so this is an example of a package insert. You can see, you will find that leaflet contains all the information which is given by the company. Now ibuprofen 200 milligram tablets, what this medicine is for, before you take the medicine, how to take the medicine, what are the possible side effects, how to store this medicine, and further information. So all the details about this medicine have been given, which needs to be, we should tell our students to gather these package inserts and study them so that they can counsel well to the patients afterwards. Okay, how to make use of package inserts and leaflets for counseling of the patient, that needs to be covered. Okay, now the 6th chapter is regarding the medication adherence, which is for 2 hours, where you can, in the first chapter, you can cover what is the definition, what are the factors that influence the non-adherence, and then in the next lecture, what the strategies you are going to come up with so that you can overcome this non-adherence. As a pharmacist, what is your role in medication adherence? Now, let me tell you what is happening in an international thing is they are giving post-pharmaceutical care, means pharmacist is responsible if the patient is not adhering to his medications. That is not the case in our country, because we are still in pharmaceutical care. Therefore, you can see in case of this strategies to overcome non-adherence, you can see this. This is one of the strategy that at the breakfast, these 4 tablets need to be taken by a patient. What this pharmacy in US has done, they are having a packaging machine. All the tablets are packed into this pouch. So the pouch is given separate. This is for breakfast, which is very easy for handling for a patient. Or otherwise, if you say, ek goli hatli kya, ek goli tyatli kya, they confuse. Sometimes they forget to take one of the tablets. So that is a possible cause. I'm giving one of the causes. So see this, what they are doing in a pharmacy, they are giving one pouch where all 4 tablets are there, packed inside, so that that patient has to take at the breakfast. So he can read the breakfast. What he has to do? Very easy. Take the pouch of breakfast and take these medicines. That's all. Okay. So that type of things are being implemented into the pharmacy so that the non-adherence is there, because the effective medication or therapy will take place only if the patient is going to adhere to the therapy. Okay, so within the 2 lectures, we have to see the first one is factors responsible for non-adherence, and second one is what are the strategies which we can implement as a pharmacist so that non-adherence can be overcome. Okay. 7th chapter is regarding health screening services in community pharmacies. We have 5 hours devoted to that. And what is expected? That you should go for routine monitoring. You have to see few diseases like that of cancer or maybe some other, that early detection can be done because the patient is coming to your place. And then you can refer these undiagnosed cases to, if somebody is coughing for so many months together, can you tell them that go to the TB center so that, or let him go to the hospital to see whether he's suffering from the TB? Just by looking at whatever the symptoms you can see, or you can do some testings and then you can ask him or refer him to the doctor. So that is what is expected of you. So health screening services not present in the earlier syllabus. It is there. We have to devote 5 chapters, 5 sessions for this. Okay, so health screening services. First one, we can keep the sphygmomanometer, digital sphygmomanometer. How to use it? You can teach it to your students. You can show this video to your students and let them able to do it, because this is there for the practical. They will do it and they will be able to monitor in their own community pharmacy. So how to use the digital sphygmomanometer? This is the first thing which they should do in health screening services. Now, the second thing is, maybe you can use a glucometer. You have to educate the patient of using the glucometer. So you can use a glucometer. Likewise, you can keep this screening services of using a peak flow meter. How to use the peak flow meter? So this is the health screening service of using a peak flow meter into your pharmacy, or even you can, if the patient is using at his home, you can guide him by giving the training of using this. Then we have another incentive spirometer. How to use the incentive spirometer? You can use this as a screening service into your pharmacy. You can even teach your students to use the oximeter. Even you can provide, because if in your college, in your community pharmacy, the stadiometer by which you can measure the height, then balance will be there, and you should be able to calculate the BMI. And based on the BMI, you should be able to give some guidelines, because your role in health is very important. Promoting health is very important. So this service can be given. So all these health screening services needs to be given by a pharmacist in his community service. So in those 5 chapters, 5 lectures, you are going to discuss with the students about this health screening services. Okay. Then comes the chapter 8. This is over-the-counter medications. 15 hours have been given to this. It is because there are so many OTC products which doesn't require any prescription, they come to you and you are going to counsel them. You are going to give medications. You are going to advise the patients for the self-care in minor ailments. And therefore, your counseling is very important. What is the role of pharmacist in dispensing OTC? That you are going to cover. You are going to counsel the patient for OTC products. There are so many OTC products. So which are the minor elements? Which are the OTC product? What counseling tips needs to be given for the specific type of OTC product? That needs to be discussed, and therefore counseling of OTC products will take more number of lectures. Role of pharmacist in self-medication. Many of our community pharmacies are giving the antibiotics as a self-medication. The patient is asking doctor, and the pharmacists are giving, even though if they are come under Schedule H drugs. So what is the role of pharmacist in the self-medication? That needs to be told to our pharmacist. What is the rational use of medicine? That needs to be told to our budding pharmacist. And what are the various minor ailments and what is the treatment, how they are going to take care of that. Okay, so the patients who are coming to your counter for OTC, these 15 hours have been given to you and you can segregate. Okay, counseling, minor ailments, counseling for OTC products, counseling for self-medication, counseling for minor ailments. These needs to be covered in 15 hours in the chapter 8, that is OTC medications. Whenever the patient comes, this is the VAM. There are so many things which may not be covered by me. Okay, but VAM, whenever a person comes to your community pharmacy, you should ask, this medication over the counter, who for? It will tell that it is for children or not, for adult, geriatric, for whom? What are the symptoms? How long have symptoms been present? And action already taken by them, what medications they have taken. So this VAM needs to be taken care whenever the patient is coming for asking OTC medications. Okay. Now, that's the end of our 8th chapter. Now, 9th chapter is also very, very important. Much of the things were also present in a previous session, in previous syllabus in drugstore business management. Okay, those have been taken over here. 25 hours are given. So you need to segregate. Maybe the legal requirements of community pharmacy, 10 square meter, or whatever it is, for wholesaling, for retailing, and whatever it is, you need to give the legal requirements. You need to give, because they need refrigeration and all those things. Then we have to teach the students about site selection requirements, what a pharmacy design should be, latest pharmacy designs, how the interior can be done. Okay, and then the vendor selection and ordering, these things will come. Okay, so you have to divide your sessions based on this, maybe legal requirement 1, site selection requirement 1, along with pharmacy designs and interiors 1 session. Then vendor selection and ordering maybe 1 session. Then we can go for inventory control management. Okay, one of the session, financial planning and management, accountancy, pharmacy operation software, all these things. Already DSBM you have covered, therefore I won't be going into the details, but you can plan your sessions for this one, because inventory control management is one of the important things. Not only that, financial planning, accountancy, all these things, because that's why our pharmacist is a 8-star pharmacist. Therefore, these things, these skills needs to be known to him, and that we need to give to him. Then pharmacy operation software. Maybe people will say, because even I inquired with so many, which medicals are using which software, how much is being charged. For a pharmacy institute, it may not be possible to purchase a pharmacy software. Why? Because we don't want to pay for that. Okay, let's see if we can get free. But what we have done is we searched and we found out one open freeware pharmacy software, which you can use even in your institute. Okay, so just I'm giving the address of it. Okay, pharmacy operation software, which is a freeware. Okay, which is my pharmacy software, which is available on this savansoft.com. You can get all sales, stock, search, reports, purchase, everything. And this is free of cost because it has been given as a freeware so that the one, those who cannot afford can use this pharmacy operation software. How to operate it? Maybe in the next session when we are going to cover the practicals, or maybe sometimes I will make it a point to discuss with you. Right now we don't have time, but you can install this free of cost in your colleges, where you can ask your, because there is one practical on this pharmacy operation software, which we have covered using this software into our practical. Okay. Then comes few more points into chapter number 9, like customer relation management, audits in pharmacy, SOP of pharmacy management, digital health, health, and online pharmacies. Due to time constraint, I'm not going to cover anything of it. You finalize how much time is to be given for all these things. Okay. And then you can go for, this is the laboratory manual which we have come up with, so that all 25 experiments have been covered into this community pharmacy and management. But I'm not going to discuss anything about it because we are very eager now to discuss with listen Raj Vaidya sir, his practical aspects rather than whatever I have covered theoretically. So that's all from my side. Thank you, dear teachers, for patiently listening me. Okay.
Yeah, thank you, sir. I guess Raju, any questions? Any questions? Anyone has any questions for theoretical part? Yes, not right now, but we'll have the questions at the end of Raju sir's session. Then we can have theory and practical session questions combined. Is it okay, sir? Right, sir?
Yes.
Yeah. Okay. Raju sir?
Yes, yes.
Yeah. So you're there. Okay. So we can start with your session, sir.
Yeah.
Yeah.
Thank you very much, Dr. Aditya, for your kind introduction as well as a wonderful program organized by the team that we have put together. After hearing the theoretical aspects from Dr. Dias, I will go into. Is my screen visible now?
Yes, sir. Yes, sir.
Fine. I'll try my best to finish in the time allotted to me of 30 minutes. And I will talk about the practical aspects of the curriculum of community pharmacy and management. This is a very important addition into the curriculum because this could ease some of the burden of the pharmacies, hospital pharmacies or community pharmacies where the pharmacy students after passing out will go into for training, because that will reduce the burden of those who are doing training or as well as those who are employing these pharmacists, because a whole lot of information can be given based on this new curriculum that has been developed, and special focus on hospital pharmacy, special focus on community pharmacy, and inclusion of a practical which is unconventional, not like the routine laboratory chemical and animal handling practicals. So this is really a practical and hands-on 75 hours that we can use very fruitfully during our practical during the course. So this is our pharmacy, and this is our counter and a patient care area. And our pharmacy is big, and it is sort of like what is being suggested by the ER 2020. We have to keep in mind that we also have to look into that the students would finally end up in pharmacies, medical stores, which would be much smaller than what is prescribed in the model. But the model is there so that the students can learn and interact with the faculty as well as dummy patients. Now, the 3 hours a week is quite sufficient, and provided it is made the best use of. And 75 hours you can cover lots, because there is no end to the timing that is available. But considering that the DPharm course is 2 hours, 2 years, some of the things, very important things, could get missed out. So similarly, in this particular course, whatever best possible has to be taught, and we have to try and make it a very good integration of what is there in theory and practical. Quite a lot of things are overlapping, because theory gives the base, theory gives the background, and the practicals can allow the students to actually implement it in the lab. The lab is the model community pharmacy, which is prescribed in the curriculum. So theory and practical should go hand in hand. So since sometimes the theory is for 8 hours, 15 hours, at the same time, simultaneously, as theory is being taught, those correlated practicals can also be covered during the practical hours. So a good combination and good target of the theory and practical faculty, if they are separate. If it's the same, then they can always make a good gel out of it. And the assignments also have been, even though the student has to only do 3, but they can also be built into the practicals, or they can be built into the actual practice which the students can do at the model pharmacy. The field visit includes only visits to community pharmacies, and this also can be done. So here, this is some suggestions for the faculty. Since you are going to teach community pharmacy theory and practical, and others also who are teaching related subjects, it is good to have good exposure to community pharmacy working. It's not difficult to do that. There are thousands of pharmacies all around, and if you can devote some of your time either at the weekend or sometimes in the evening or during vacations, contact pharmacies and have some sort of verbal agreement, or the college can have an MOU wherein the faculty can go and spend some time there. Do hands-on work if you are permitted to do that, or simply observation. You can learn a lot what the pharmacists are facing, what are the problems that they have, because ultimately, as the last line says, you are there to learn as well as to teach. You can learn from the pharmacy staff and the pharmacy owners, their way of working, and you can also teach them, guide them, give them modifications and tips as to how they can improve their professional practice as well as their business. So you can visit small and big community pharmacies, view them from outside, view them from inside, give them visits, see if you can work there, spend some time there. Ultimately, the purpose is to learn, and teaching and learning will go simultaneously. Then you can pass on these suggestions to students, right, when they are even in their first year, and even when they join first year or second year or before that. Visit different community pharmacies in the vicinity, see how they look, see how the models are, see how their interiors look, see how the getup is makeup is, see what type of shelves, everything, whatever can be seen. If possible, students can opt for voluntary internship in these pharmacies or work in the community pharmacies so that they can get exposure and better understanding. Because working on the ground, actually in the place, is the best learner. So what you learn in theory and what you learn practical in the college will go definitely better hand in hand, and you can correlate better when you work at the pharmacy, and you can learn the curriculum, not only this curriculum, but other pharmacy subjects. You can learn better when you actually see what is a dosage form, what is a prescription, etc. So students could work on weekends or on vacations or whatever little time they can. Every hour spent there can give plenty of inputs. Now, this is what is recommended in the year 2020. Essential, it says it's a running model community pharmacy. That means an actual pharmacy which is operating in the pharmacy. I don't know to what extent that is practical. And if not that, then it should be at least a drug model store. I would call it a model community pharmacy in which there is no actual medicines and no actual dispensing happening. but it is a lab, an experiment, a place where the faculty can interact, teach, demonstrate to the students, as well as the students can learn in a simulated actual a model community pharmacy. So the area given is 80 square meters. That's quite big, and it gives a good scope for putting into place different things. And this also includes a 10 square meters of drug information center and 10 square meters for patient counseling. Now, sometimes you may feel for use as a demonstration or session for students that 10 square meter may not be sufficient. So certain things can be done in the lab or in outside in the community model pharmacy. And for certain aspects, you can use the patient counseling area for doing demos 1-to-1, 1-to-2, or conducting trial examination or mock session. Now, this is what is prescribed in the model pharmacy. So these are the things which are quite easily available, and some of the things are very relevant because these can be used in a much better way for training the students. And this is actually what is needed. What is there in the pharmacy can actually be put up in the model pharmacy. And you can take the help of practicing pharmacists, chemist association members, or owners of pharmacies in your neighborhood. So they can give their suggestions, they can give their ideas. You can visit their pharmacies or different pharmacies, and you can build up this model place in 80 square meters. Then teaching faculty and the students can be a part of this and developing this model, and also make continuous improvement on it. As we see more things, as we learn things, because for everybody, this is something new. This is a new concept which has been introduced. So what is 80 square meters? Will it be enough or is it too much? We will only come to know when we actually start using it. And I feel it's a very good grooming place and a good place for learning and experience for the students and faculty. Hands-on experience is best obtained by doing it actual in the lab. The lab is the model community pharmacy. So we get a lot of training students for training, both from BPharm, MPharm, and mainly diploma in pharmacy. So what is learned in theory and what is learned in the practical aspects is completely different than what you actually learn in a community pharmacy. So a model community pharmacy is a good simulated place where the students can have a feel, actually see and feel what are the different things listed over here. So they can actually learn things and they can visualize better. So what are the practicals which have been listed for community pharmacy? And even some for clinical and hospital pharmacy, they could be done in this pharmacy. But since there would be around 15-20 students per batch, if we feel that this place is not enough, students can be divided and put into a nearby lab. Those adjustments the college will have to manage. You also can involve the practicing pharmacists in the neighborhood or owners for doing demos of certain things or setting up certain things, as well as to take part in activities or practicals, at least for the first 1 or 2 years, so that we can learn from them. Also, it will be a good learning experience for them. Now, coming to the actual practicals which are listed in the curriculum, it says the following practical shall be carried out in the model community pharmacy with appropriate simulated scenarios and materials. So the community pharmacy itself is a good simulating place. What we have to create is the scenarios and the materials, which the faculty will have to gather over a period of time. So students can be trained through role plays wherever necessary, and the activities can be assessed by assessment forms, structured objective assessment forms. So here there are first three listed over here: handling of prescription, professional standards, reviewing prescription, legal compliance and completeness. The second is about drug interaction detection in prescription and what to do. And the third one is of preparing dispensing labels and auxiliary labels for the medications which are being dispensed. So now this is covered quite deeply in theory. There is a lot of time given for this in theory. So the theory and this practical can go along together. Some foundation can be built in the theory. This is the part of the theory which talks about it. And the actual hands-on things can be created in the practical lab, that is the model pharmacy. So the students can go hand in hand with what is taught in theory, correlated to what is can be learned in the practical. So the students will have to brush up on the physiology, pathophysiology, pharmacology, and therapeutics, because this needs to be important and relevant, especially with reference to drug interactions and some legal aspects, the Drug and Cosmetic Act, with relevant to legal aspects. And students also here need to build up their communication skills, patient counseling skills, as well as the medication adherence part in what is there in the theory. So these things have always to be correlated with what is being taught in theory. So the students can grasp better what is taught in theory. Simultaneously, in 1 or 2 weeks, it is also covered in practical, and then you go back to theory, and some of the theory aspects can be also covered during the practical aspects. And for the dispensing label and auxiliary labels, the students will have to be shown or get well versed with the National Formulary of India, where the list of auxiliary labels is mentioned. The BNF has an exclusive appendix on that. And there is International Pharmacy Federation's pictograms, then USPDI has its pictograms, and various other countries, US, Australia, they do a lot of labeling, patient-centric labeling as well as auxiliary labeling. So based on these references, the college can create its own labels and own auxiliary labels. And by this, two things can happen. One is, in India, we do not have this practice, unfortunately. This practice will build up. Students will start learning what this is, and we can slowly put it into practice as time goes by. So learning good dispensing practice can be done at the model pharmacy. The one aspect is about the prescription, reading the prescription, handling prescriptions. So a lot of this is covered in the GPP manual, Good Pharmacy Practice Training Manual, which Dr. Dias has spoken about, which was made by the Indian Pharmaceutical Association. Now, these prescriptions could be actual, may not be actual, because then it comes to patient confidentiality. But we can create demo prescriptions, or we can create transcribed prescriptions, or we can ask doctors to create prescriptions for us from our neighborhood. And the students will be able to learn different abbreviations and short forms when they read such prescriptions. So they can build up their vocabulary of what are the different things in the prescription, how easy or how difficult it is, and terrifying sometimes it is to read prescriptions. Only chemists know. So the students should get that simulation right in the lab. And by this, they'll be able to learn different brands, brand extensions, of course, generics, as well as fixed dose combinations. There you can introduce rationality, irrationality as well. And nemesis is the reading the handwriting of doctor's prescriptions, that you can start learning. It's only with experience that you can learn. And even after experience of 30, 40 years, many times we fail to read a prescription handwriting, but then we have to begin somewhere. So for assistants, we can have on board or take assistance of doctors, chemist association in the neighborhood, practicing pharmacists, owner pharmacists, who I'm sure will be willing to help the college in developing all these things. The next is to check for drug interaction as part of good dispensing practice at the model pharmacy counter. So using the model pharmacy counter, so you can have actually a counter, will give that real feeling, so that the students can be one side and the customer could be another student, can be other side. So the actual role play of how dispensing can happen could be shown. So that the students can then be taught checking for drug-drug interactions, of course, simple things in the beginning, and check with the patient for clarifications if it doesn't understand certain things. So such certain clues can be set up for the students, and locating the medicines, where different medicines are kept in the model pharmacy, using the computer, using the pharmacy software, then assembly of medicines, picking up the different medicines from the different shelves, of course, as a demo, and putting them together and sending them for billing and packing. So here again, we can seek the assistance of the chemist associations and pharmacists in the neighborhood. Then the next part is about the same prescription, handling, assembling, and then comes the labeling, how the product level should be, how the ancillary level should be. So this we correlate with what we learned in theory, as well as certain things can be developed in the practical. Students can be asked to produce product labels, just like we used to do in the dispensing and pharmaceutics practicals. So this is a different exercise, and this is now going to be actually applicable in practice in the near future. So once when we start doing this in the practicals, and this is the first time that it is happening, we can slowly put it out into the actual reality. Then what patient instructions to give based on what is prescribed. Patient instructions I put so that patient generally doesn't have time. So it's not always that patient counseling in a big, long 10-minute, 15-minute session can be done. So what are the basic things which need to be told to the patient in that short time which the patient has? So these things also can be simulated. Patient says, I don't have time, I have only 5 minutes. So in that 5 minutes, whatever little you can explain, then if you can convince the patient, that is the dummy patient, that so much information I have, and if you find it useful, wait for some more time. Then creating patient information leaflets, and patient counseling can be then, other demos can be done in the patient counseling area, the 10 square meters which has been allotted. And patient information leaflets can be also developed. What is also existing can be read, the students can be exposed to that. And for this, we can take assistance of maybe presently the owner pharmacist or practicing pharmacist may not be able to be apt at certain things, but we can take the help of PharmD students, of practicing pharmacists in clinical pharmacists. Whatever possible way we can do, we need to do that. Then students need to be exposed thoroughly. This should be as one of the ready reckoners with them. The good pharmacy practice guidelines, these are which have been set up by FIP and WHO. The Indian Pharmaceutical Association also has made Indian-centric guidelines. And then in 2005, the training manual. So this has 6 modules for regulatory affairs, procurement and inventory control, storage and stock management, dispensing, patient information, and rational use of medicine. So these are simple step-by-step material which has been prepared, and it will be very easy and apt for the students to learn from this. Then this is more for the reading of the teachers, faculty, developing pharmacy practice. Then this is a community pharmacy section, FIP's vision document. So like this, lot of information is available because most of the developed countries have well-developed community pharmacies, lot of information, etc. So a lot of things are available free of cost. And today everything is available at the fingertips. So a whole lot of things can be procured so that teachers can learn these things. Maybe slowly we can pass it on to the students. Not everything could be easily grasped by the students. Now the next slide is about providing health screening for in the pharmacy. So these are the things which have been listed: sphygmomanometer, blood glucose monitor, peak flow meter, incentive spirometer, pulse oximeter, and measurement of BMI using height, weight, and the formula. So students can be specifically taught this because it is very important, according to me, that by the time the students are out of the college, total 2 years, because some of these things are also taught, I think, in physiology and pharmacology or something in the first year. Important to ensure that student is equipped to do this point of care testing services. These are very simple to do, and some basic training is needed for the students to do. Then so they can be shown videos of handling and correct use of devices. Of course, the faculty can demonstrate them to them first or after this, provide them proper training, exposure and practice in the lab or at the model pharmacy, and then provide them or make them learn the related tips and interpretation of results, counseling to patients based on the test results of these tests, and how to document these tests and how to convey them to the patients. So again, the students will have to brush up on the different subjects that they have learned, especially in the relation to this. So it's diabetes, asthma, and several other things. And what is important is also their communication skills can be tested over here. Some part is learned in theory. There's no separate dedicated session for communication skills in the practical session, but communication skills comes into play at every step. So whatever the students are doing, whether it is reading the prescription, handling the prescription, dispensing instructions, counseling, doing demos, or doing POCT, communication skill is inbuilt. There's no need to teach it separately. What is taught in theory needs to be corroborated, and then the teacher can watch the student and give suggestions how they need to change, what changes they need to do in their communication. A lot of information is available worldwide on point of care testing in pharmacies. This is for faculty to go through. This is FIP statement of policy, and a new upgraded statement will come up in a month or two from FIP. And many countries have their own policies for point of care testing. So the faculty can go through that so that they can learn better and provide them information to their students. Then the next practical, the fifth one, which is mentioned, is providing counseling to simulated patients on chronic disorders, including education and the use of devices. So there are two parts of this. One is handling and use of devices, which are to be used in patients of diabetes, hypertension, asthma, hyperlipidemia, and rheumatoid arthritis, and what counseling is to be given to patients on these disease and disorders. So here again, we can make use of different demos, videos, and of course, faculty can do hands-on usage and give good amount of practice to the student. Then there are different insulin pens, cartridges, insulin vials, and syringes, and it can be very confusing which cartridge to use, which pen to use, which type of vial to use, which syringe to use based on what is prescribed. And very often a mistake can be fatal. So these need to be explained to the students. And when they actually see it in the model pharmacy, they can understand things better. And similarly for asthma, the student should be well trained in hand-mouth coordination, how to use this, again with the help of videos and actual practice. So different manufacturers make these sort of products. So we can easily tap into the company medical representatives who I'm sure will come willingly and give demos to the students in the model pharmacy or in the classroom, wherever is required. And they can also provide a lot of videos of this. Of course, a lot of videos are available online. And patient education material also many of these companies provide. We can make best use of them so that we can learn, faculty can learn, and students can learn, and they can then learn how to teach it and pass on that information. So these are some of the insulin. So this is 100 IU, this is a cartridge, this is 40 IU, this is 100 IU, which one to use. So these things need to be told to the students, and that can be best done hands-on. 40 IU vial, use of red one, 40 IU syringe. Same way. Then we also have a 200 IU pens introduced in the country. They should not get confused. Moment they see it in the model pharmacy, of course, we have to arrange for demo or used pieces so that they cannot be misused. And same way, this is a part of the kit which is supplied for asthma devices by Cipla. Similarly, other companies provide, and they come and do their demo. They provide these kits. I'm sure they will be willing to do it. This and many other companies for the college. Just need to connect with them and call them and then learn from them. Now, this is an example of a pharmacist. This is Sagar Kulkarni from Kalyan, who has been doing this for quite a lot of years, many years. So many students can be taken to such pharmacies to see what they are doing. So he has his own library of his own, various demo devices, does nebulization, he's a DOTS provider, how to use different asthma devices, BMI, as well as blood pressure monitoring. So when it comes to counseling of patients on disease disorders which has been listed, these 5 have been listed because they are very important and more common of the chronic disorders. So based on this and based on what is taught in theory, the student will have to brush up on their physiology, anatomy, pathophysiology, pharmacology, therapeutics, and of course communication skill. So a combination of all these things need to be imbibed into the students as they do this particular practical on counseling patients on these 5 different conditions. In same way, the next practical is on providing simulated patients about minor ailments. So they have considered headache, GI disturbances, worm infestation. So these are the common conditions for which the patients come to the pharmacy for asking for medications or advice. So minor ailments is a very important component for pharmacies, and different developed countries has well developed it because they have well developed defined OTC medications and what are the roles of the pharmacist. Once we are doing this, we also can put it up further and take it up further in community pharmacies. So here the students will have in their mind providing information to the dummy patients about non-pharmacological methods or home remedies, as well as non-prescription medicines or OTC medicines. The students will have to be provided inputs. The faculty will have to provide inputs on what are the basics for history taking on these different disorders, what are signs and symptoms, and what are the differential diagnoses, what are the danger signs, what are the things where they should draw the line and say, sorry, I don't understand. That is, pharmacists, we don't understand. And so we need to refer the patient to the doctor. That's the best we can do so that we don't unnecessarily prolong the illness. Then what are the treatment algorithms we can prepare for these different ailments? So all this can be based on what is taught in theory. A lot of time is devoted to theory. So there some groundwork can be done and that can be actually implemented in the practice. So here again, the students will have to brush up on these different aspects related to these conditions. So here also, now when we are talking about practical 6 and 7 about chronic diseases as well as the minor ailments. So some preparation will have to be done for the practicals for each of these conditions. So the faculty will have to prepare the charts of test values, tables, do's and don'ts, what are the different counseling tips which a pharmacist can give, what are the lifestyle modification for each of these ailments, what are the simple, and then the students can be given simple case studies so that they can learn better from case studies, or problem solving so that their skills in problem solving of these particular situations can be enhanced. Then frequently asked questions can be built up. What are the possible questions that the patients may ask? And of course, use how best to use the patient education material which is available, or this can be developed in the model pharmacy or the college by involving students in any of these activities. The students are very good in many of the things. What they need to be shown is the right channel, right motivation, and the guidelines. From time to time, correct them. And they can be involved in competitions, or they can have competitions, and various help days can be celebrated in the college, as well as involved students when, as UGC has said, each university or college should adopt 4 or 5 villages. In that concept, the students can be involved in community camps. What they are learning here, they can actually implement over there, doing point of care testing, providing information to patients. Now, this is just a quick example on the left-hand side, which has been prepared. I just gave an idea what they should do, and they have come up with a beautiful, innovative poster. So these are students of DPharm who have just passed out, and this was done for breastfeeding day, and this I told them to do for illnesses in the rain. So they have done it in an impressive way, and we have put it on our health information board in our pharmacy. So students have talent. They can create videos, they can create posters, they can create quizzes, so many things. We just need to guide them and make the best use of them. So it's good for them and it's a good learning thing for them also. So the model pharmacy can actually do a lot of things. And on the right hand side is some of the patient information leaflets which we use in our pharmacy. So these also can be created by the colleges so that simple things can be taught to the students. Then the 7th practical is about appropriate handling of dummy dosage forms and learning how to correct administer them, whether it's oral liquids or eye drops, inhalers, nebulizers, or tablets. What are the different types of tablets, when to break, when not to break, what are scored tablets. So many of these things the students do not apprehend or come to know when they're taught in theory. But when we show them actually in the pharmacy, they grasp things very well. They grasp things much better because seeing is different than what is studying in theory. All these things, what is learned in pharmaceutics can be put here in front of the students. Of course, this can also be done in the pharmaceutics lab. And here they can be taught how they can actually be used and what patient instructions to give. Because if you look at the labels of the market products of these products, you will realize that what the patient is in for. First of all, it's written all in English. Second thing, there are hardly any information or instructions which are written on the label of most of the dosage form. So it's up to then the pharmacist. Now, for the pharmacist to instruct them, the students should be well prepared during their curriculum days so that they can learn and they can then easily pick it up. So we can make charts of instructions for correct handling and administration of various dosage form. Then we can learn from various demos, videos, or hands-on practice, or the students can make their own videos so that this can be used to educate the patient. So these are very important tools in patient instruction and counseling also. So that is why the student also need to learn all these different things. So for this thing also, we have plenty of every day, a lot of dummy dosage forms are generated, empty cartons are generated, or we can collect empty bottles from patients or from our neighborhood and mark them so that they are not used. As much as demo of these dosage forms are available at our model pharmacy, then the students can learn and visualize better. Now, the students can also be tested for technical aspects and their communication skills when they are learning this and when they are doing the demos to dummy patients. Now, the curriculum says that one should provide counseling to simulated patients. Now, we may not be in a position to talk of actual patients, or like there are volunteers who are trained as patients in many of the developed countries, both in medical as well as in pharmacy. Maybe we have not reached that stage, but we can do what best is possible for us. So one of the person who is providing counseling can be a pharmacist and the other one can be a patient. So we can start with something like 2 faculties, one behaves as a pharmacist, one as a patient. So they demonstrate and do actually so that the students can visualize that. Then next step, 1 faculty and 1 student. These 2 can demonstrate and others can watch. Then 2 students can, one as pharmacist, one as patient. So different situations, whether it is minor ailments or showing demos of POCT or variety of things, 2 students can be done. Then we can involve somebody who is unknown entity, a student plus non-teaching faculty in our college. To what extent we can go for the dummy patient, I have left it as a question mark. So for doing these things, for patient instructions or its counseling, you can use the patient counseling area, which is designated as 10 square meters. Maybe that can be used for the examination or doing actual one-on-one sessions. But for in general, if the bigger demonstrations are be done, then you can use the laboratory. And the sessions could also be recorded, of course, taking due care, so that the 2 persons who are actually interacting, they can do so without any hindrance. And whatever is recorded then can be played back. And then the faculty can, as it is played, the faculty can then point out, that's the correct thing you did, this is something slightly wrong, this is totally wrong. So here The students can learn from their mistakes, or they can enhance, and others can enhance from their whatever correctly they have done. So here we can check the technical aspects of whatever information or discussion is happening with the dummy patient. And also we can develop their communication skills automatically so that they also get confidence. So when they end these 2 years and go into community pharmacy, they should be ready to do a lot of things, if nothing. So it is very important to have at the model pharmacy. These are some of the things which have been listed. Variety of empty immediate cartons of different dosage forms and empty product containers of various dosage form of different brands. Lots of these are generated in all the pharmacies in your neighborhood. You can simply go and collect. So what we generally do is it goes into the dustbin and it goes to the municipality. So if colleges are willing to learn and so much is generated, so many new products keep coming and so many things to learn. So these are useful for students to examine, explore and learn various aspects, because actually seeing the products is different from just imagining it in the theory. And when you can see it in the model pharmacy, is nothing like it. So what is written on the labels? Some things which are mandatory and some things which are additional. And what are the different dosage forms, how the labeling is done, and what instructions are there for storage or warnings, schedules, what is written on that. And they can learn different brands, different companies, contents, fixed dose combinations. So many things can be done. Even when some other students are doing something, the other students can be allotted to explore these things so that they can learn. And I'm sure all of us can chip in into sharing our empty boxes or dosage forms. And of course, pharma companies also can be brought in. Then why do we need to have shelves at model pharmacy? So these shelves can also be the real ground which Karma Bhumi, where students can practice. So actual shelves, some drawers, some racks, some cupboards, and a dispensing counter. Because different pharmacies, small and big, different regions, some use plenty of drawers, some use plenty of racks. So it's different. So different things. So students can learn different things. They can learn to arrange medicines, the FIFO and first expiry out, how to keep them. They can learn to keep them clean, wiping, dust-free, and standard operating procedures can be developed based on this for cleaning. Then doing window displays, that is also part of theory, increasing how to increase the business. Then check for storage conditions, checking temperature, documenting temperatures, documenting humidity. So also at the refrigerator, cleaning the refrigerator. Actual cleaning can be done or can be taught to the students, how to measure temperatures and recording the temperatures, how temperatures have to be regulated, and what is the correct method of storing different products requiring cold place, cool place. So all these things can be actually taught. And the last aspect in the practical is community pharmacy softwares and digital tools. Now, digitalization has flooded the market. So sometimes the students know better than us. Maybe we also can learn certain things from them. So one thing is important is to make them operate and actually play on the billing softwares, because that is one of the important components when they work in the pharmacy. So I'm sure we can upload some common inventory and billing softwares. We can ask any of the companies from the pharmacies who are around. They can definitely put a dummy in which you cannot actually use it in practice, but you can practice on it. A lot of things can be fed in that. So practice dummy can be fed on the model pharmacy computers, 1 or 2. The students can be shown the demo of the usage. The chemists can show them, come and show, or the company can come and show. I'm sure they'll be happy to do. And then give them students a free hand to handle this. Type, searching for medicine based on the location, doing product entries, purchase, bill entries, preparing cash memos. Let them learn, let them actually be hands-on with this. Because today, students find it very easy to learn the computer and it's not difficult. When they learn these things over there, they will also get that feel of satisfaction that yes, we have been generated with good knowledge by our faculty. And exposure to different digital apps, maybe different pharmacy ordering apps, or different product information app. A lot of things are there. So a few samples can be taught to the students. Then the whatever I have spoken, I think a lot of that is covered in the assignments, and the students only have to do 3 assignments. So as they live and breathe in a model community pharmacy for quite a lot of time, as we expose them to different things, I'm sure they'll be able to do these assignments, and it's not too difficult, and teachers can be allotted to them so that they can develop that assignment better. So through this, students can be asked to produce information leaflets, patient package inserts, or so many other things they can do, and then they can present. And field visit for this is only visit to community pharmacies and wholesalers so that they can understand different professional activities. So that I had also mentioned in the beginning. So with that, I hope I didn't take too much of your time. I'll end here. Thank you very much for patient listening and giving me the opportunity to present.
It's our pleasure, sir, that you are here to guide us, and really thank you for the session. I would like everyone to put their questions, if there are any, into the chat box, or you can raise your hand if you are having any questions related to community pharmacy and management, either theory or practical. So it won't be an issue. Okay, we'll wait for 2 more minutes, and then if not, then we'll have a 15 minutes break and we'll start the next session at 2:30. Okay. So the last slide in theory, customer relation management, all are new. Please discuss. So I guess, Dai sir, you are here?
Yes, sir. Yes, sir. I will just share the slide. And...
Sure.
Yes. The madam was asking to speak on this slide. So just see, customer relation management. After all, we are giving the patient care services, but still the patient is our customer. And as far as Gandhiji has said, customer is our God. And therefore, the customer relation is very, very important for any of the business to flourish. Here we have 2 things. One, the business is there. Second thing is we have a patient care to be given. And therefore, the relation needs to be established with the customer. So maybe by using some softwares, you are going to create a database of your customers. Along with that, maybe you are going to organize certain things or certain maybe some lectures or some testing drives or some courtesy calls to a customer regarding their disease management. Okay, so by using the management principles, how you are going to improve the relation with your customer, because once you establish that relation with the customer is going to be always with you, and therefore your business is going to depend on that. Therefore, customer relationship management, which is a management principle, needs to be discussed in one of the sessions or the lectures, I can say. The next is audits in pharmacies. See, audits. The audits are done by FDA, by the drug inspector into your pharmacy, but the internal audit is also important, because right now we listen to Raj Vaidya sir. It was experience which he has shared with us, and he has talked of having those SOPs into the pharmacy, and you should follow those SOPs. Same way, the SOP should be there for audit, internal audit. So maybe you or somebody else should carry the audit as per the SOP into the pharmacy. So audit of what? Audit of everything. Maybe you are going to do the audit of the refrigerator. As far as SOP is concerned, whether the refrigerator has been cleaned by following the SOP. Means starting from your financial management to the inventory control management, everything needs to be looked upon in the audit, and this should be internal audit. Okay, what external audit is expecting, all those things needs to be included in the internal audit, and periodically this internal audit needs to be taken. Okay, so that comes in audits in pharmacy. What are the points? Those are present in audits that you can explain to the students into this session. Then SOP of pharmacy management, the overall management of pharmacy, starting from inventory, bills, accounts, till the first in, first out, whatever type of inventory control you are going to do. So all those pharmacy management, the SOP should be there. So all the SOPs together of whole pharmacy management. No, the credit goes to Raj Vaidya sir, because if you can see the training manual, just I want to ask one question to Raj Vaidya sir, that these IPA training manuals, if they are available with IPA, then we want, every college wants to have the copy of it, so that these SOPs can be prepared, because this will be the exercise for every pharmacy college to prepare the SOPs and keep it in their model pharmacy. Okay, so that the student will come to know how to handle the SOPs. Okay.
Yeah, I will update on that.
Yeah.
I think they are available, but if larger numbers are required,
yeah,
we'll get back and convey.
Yes, sir. Yes, sir. Just give us the status so that we can just contact that IPA office and we can get the copies. Thank you, sir. Then the digital health, health and online pharmacies, there is a mushrooming of online pharmacies. What are the pros, what are the cons, and what regulations are in place for online pharmacy? That needs to be discussed. For the digital health and mobile health, even if you can go to the government website, no, there are certain apps. Okay, maybe we have used during Arogya Setu during the COVID. Likewise, there are few apps which are present in on our government website, National Health website, nationalhealth.go.in website, where you can get lot much of material on digital health and human health that you can discuss with your students in that lecture. Okay, so this is what regarding my last slide. Okay, I think any doubt, madam, you can ask me.
Sorry, sir.
Yeah, the madam who had asked this question, just I'm asking whether the doubt has been cleared.
Yeah, she has put that thank you into the chat box.
Okay.
Sure.
Okay, thank you all for patiently listening, and thanks Raj Vaidya sir. It was very much we were happy to hear you.
It's our pleasure, sir, and thank you so much, Dai sir and Raj Vaidya sir. So I guess there won't be any doubts in community pharmacy and management for others to listen up to. Obviously, the YouTube link would be there. The YouTube recording is there onto YouTube. So I'll be sharing the recordings to you, the link for the recordings, so you'll be able to check it again and again. So thank you, sir. So I guess there isn't much time for the break. Aragade sir. You there? Yeah.
Yes, sir.
Yes. So we'll definitely start with you, sir. Your session. Is it okay? So it was, the time was 2:30, but
Yes, sir. You can just give some break for 5 or 10 minutes. Then I will ask the Marathi sir to start the session. Okay.
Okay, sir. Sure. So we'll start by 2:35, sir. Then let's give a 10 minutes break.
Yes.
Okay. So our participant will meet back again at 2:35. So it's a 10-minute break. We can meet again. Stay logged in. Just don't leave the meeting. We'll meet again at 2:35. Thank you.
Thank you.
Yeah, hello everyone. Hello. Am I audible? Uh, Hello. Marathi sir.
You are
Marathi
audible,
sir.
sir. No issues.
Yeah. Okay.
Yes.
Marathi sir is also there.
Yeah, okay.
But
So
I don't know whether other faculty members are.
actually it's not. I have just unticked the option of what you say to unmute themselves. So it's good
Okay.
for everyone. So
Yes,
we'll
yes.
start. Yeah. So hello everyone. Good afternoon, and we'll start with our final session for the day, which is orientation on biochemistry and clinical pathology. So at first, let's meet our first speaker. So for the first speaker for the day, for this final session would be our Dr. Prashant Aragade sir. He is an in charge HOD at Government Department of Pharmacy, Government Polytechnic Jalgaon. So sir has done his B Pharm from Chandwad in 2005 and M Pharm from KLE College of Pharmacy at Hubli. He has also secured first rank in Rajiv Gandhi University of Health Science from Bangalore during his M.Pharm tenure. He has completed his PhD from Dr. MGR Medical University from Chennai, Tamil Nadu. So he has vast experience in teaching. So since 2008, he's been into teaching, and he had joined as senior lecturer in pharmacy in Department of Pharmacy, Government Polytechnic Jalgaon in 2011. Sir is very famous figure on YouTube because he has been invited to 135 plus talks as a resource person during this COVID time. He has been immense trainer, immense. He has immense skills about the online training that he has been into. So, for example, WordPress, PowerPoint, Moodle, video creations, ICT tools, NBA, MS Office, Google Apps. He has vast experience into that, and he has been training since the online sessions have begun. He has 23 research paper publications to his name, national and international. And he is, as previously said, he is a very well-known face onto the online media. So on YouTube, I guess he has around 10,000 plus subscribers to his channel. He has AICT, MSBT grants, various grants, and AICT Atal grants to his name also. And he has just now published 4 books into the as per the ER 2020 syllabus for diploma in pharmacy. So we are very glad to have you with here with sir. Here with us, sir. So welcome. Hello, sir. Hello, Aragade sir. Sorry, you're mute, sir. Yeah.
Yes, thank you, sir.
We are glad to hear. Yeah.
We will start with the theory portion with the Marathi sir.
Yeah. Okay. So I'll be introducing Marathi sir again.
Yes.
So again, we have our second speaker, Mr. Strish Marathi sir. So Mr. Strish Marathi has published 3 publications. He has 3 publications to his name. 2 elsewhere publications, 2 chapter in elsewhere publication to his name. He has also received the grant during his M.Pharm tenure from AICT. The NIE grant he has received. He has teaching experience of around 8 years, and he is currently working as a lecturer in Gita Devi Khandelwal Institute of Pharmacy, Akola, a government aided one. So welcome you, sir. We welcome you, sir. Shirish Marathe, sir. Hello, Marathe, sir. Oh, I guess. Hello, Marathe, sir. Aragade, sir, am I audible?
Yes, sir.
Okay, we'll just wait for Marathi sir to. I guess he has some network issue with it.
I think he has not joined along with the mic.
Yeah. Just
Marathi sir, just start your camera first.
Okay, I guess he's having some issues regarding to it. So shall we start with your portion, sir? Or practical? Will it be okay?
Just take some
Just a minute, just a minute. We'll
confirmation
check.
from Marathi, sir.
I'll just call him.
Okay. Till then, very good afternoon to all dear participants. Just I want to know whether you are in the meetings or not, because you know very well since from the February we are shifted from the online to offline, and now again we are going to meet through the online mode. So just try to give your presence, whether you are attentive or not. Just I want to know. So because it's afternoon, and I think you must have the lunch also. So after lunch, it's very difficult to teach, and it's very difficult to listen something, isn't it? So very good afternoon. I want your good afternoon in chat box. That's good, Kiran sir, Sumit sir. That's very nice. We have around 125 participants. All are from the various institutes of Maharashtra. Okay. Harman Patil sir is there. Aarti Sononi ma'am is there. Bhagyashali Pawar madam is there. Okay, Sunil Kolle sir, Amol Donge sir, Tosh Patil sir, welcome sir. RS JSPM, okay, good afternoon sir. Aniruddha Munde sir, Varsha ma'am, Sadhna ma'am, Sandeep Kadam, Priti Kolpe, that's good. Jeevan sir, Minal Patil, very good, very good. So good afternoon everyone. Dear Sanjay sir, good afternoon.
Marathi sir, hello. Sorry, Aragade sir. Yeah.
No.
Marathi sir, you are. Yeah, I guess you can try now.
Yes, Marathi sir, just unmute yourself.
You'll be able to unmute.
So I'm really thankful to each and everyone by sending your messages in chat box. That's good, because here myself and Marathi sir is not going to tell you how to teach, because we all are the teachers. We know how to tackle the situations, how to deal with the students. So we are not here to tell you how we are going to teach the biochemistry, isn't it? Or how we are going to take the practicals. We are just sharing some of the good practices, whatever we are following in our day-to-day life, in our day-to-day teachings. That practices we are going to just share with you. If you like it, you can follow. If you don't like, leave it, that things, isn't it? So it is might be useful to you, or it might be not useful to you, but just try to be attentive one. Marathi sir will really good hand in the biochemistry. He will share the some of the good practices that will really help you to implement it in the teaching and learning process of biochemistry. And after that, I will take some parts of the practical, how these practicals will help us to satisfy the criteria of 2 and criteria 3 of NBA, and that will really helpful. So I am going to try to map the each and every practicals with the our NBA aspects. So it will really helpful for the implementation of outcome-based education. Marathi sir, please start.
Yeah, Marathi sir, you can switch off your camera, so it would be great. Means it would be helpful for you to get.
No sure. Am I audible, sir?
Yeah, clearly, sir.
Yeah. So first of all, thank you, DYPUSOP Institute of Pharmacy, and all the co-organizers for organizing such kind of wonderful FDP. So I would like to thank you all the organizers for bonding all the faculty members around the Maharashtra region, because today is Raksha Bandhan. So thank you for bonding all the faculty members in the Maharashtra from the faculty of pharmacy. So sir, can I share my presentation?
Yes, sir, definitely.
Thank you, sir. Wait a minute. So is it visible now?
Not yet, sir.
Now, sir?
Yeah, it is now.
So thank you, Dr. Argade sir, being my being co person or co-resource person in this session. So today I am going to discuss about the new course, that is Biochemistry and Clinical Pathology, definitely from the second year. It was a big topic of discussion previous year, whether BCP should be there in the first year or second year. Now PCI has shot down a draft that definitely the BCP will be in the second year. So for the BCP, that is Biochemistry and Clinical Pathology, the course code is 23T, that is means theory. So let's go to the flow of presentation. After completion of the session, all my dear faculty members, seniors, mentors will be able to review the syllabus which is framed by PCI, and what are new topics which are included apart from the previous topics which were there in the syllabus 1991. So these are the course outcomes after completion of this course, that is Biochemistry and Clinical Pathology subject, or we can say course, not subject. Students will be able to, hello?
Sorry, sir. Sorry to interrupt, but your slides are not scrolling in our screen. You have to just, yes, now third number slide is there. Okay.
Is it now, sir? Is it fine?
Have you presented?
Hello?
Go into the presentation mode, sir.
Is it visible now, sir?
Visible,
No.
sir. Visible, but not in a presentation mode. It
It is
is.
not visible to presentation mode for ourselves. Just stop the sharing and share it again the entire.
Okay, sir. Okay.
Just click on the entire screen.
Now, sir?
Just present. No.
Wait. Now, sir, it's visible?
Yes, just go to the presentation mode.
Now?
Yes, sir. Yes, perfectly. Thank you.
Okay. Sorry for technical issue. So first, basically, when we ask student what are biomolecules, students don't have any idea of biomolecules. They only focus on the basic definitions, or we can say basic things which are usually asked in the examination of MSBT. So it's I think it's a duty of lecturer to know the basic definition of biomolecules and functions of the same, because basically students, what they do, they only learn the definition of mitochondria or nucleus, because these are usually asked questions in the MSBT examination, but they don't have elaborative knowledge about other biomolecules. So I think it's a duty of lecturer to have a complete idea, to showcase the complete functions of the biomolecules. Second, as we know, enzymology, or we can say enzymes, this is one of the best topic in our biochemistry course. So I think so we should start from basic enzymes which are present in our body or which are present in our household activities. That is, for example, amylase, which is present in the saliva. So from that we can start the syllabus, so that student will develop interest in that topic of enzymes. Then next is metabolic pathways. Many times what happens, student basically mug up glycolysis pathway, Krebs cycle, urea cycle, but they do it only for getting 4 to 5 marks. But if we will teach them what is the basic physiology, why these cycles occur, and what are the consequences if they will not work in a proper way. So if we will make proper junction between physiology and pathophysiological condition, definitely student will learn more, not only for the marks. Then basic organ function test. So this is new topic which is included in the year 2022, which is very, very important, because in COVID era, we came to know what are the benefits of this organ function test. So if we will correlate both the function test as well as the clinical significance, it will be very helpful for the students, because now the syllabus is more patient oriented. Then next, metabolites and biomolecules which are present in our blood samples. These two things which can be determined either qualitatively or quantitatively. I am not sure whether these metabolites, or we can say metabolomic study, can be done in college on the quantitative level. Definitely we can do it qualitatively. And last part is the clinical pathology of blood and urine. So I think we should proceed. So let's discuss first which are the common topics for both year 1991 and year 2020. So first, introduction to biochemistry, carbohydrates, proteins, lipids, vitamins, all these topics are moreover similar to both year 1991 and year 2022. So let's focus which topics are new to this year 2022, because the syllabus is more patient oriented. So these new topics are added. So let's see the new topics. So changes which are made in the syllabus of BCP as per year 2022, 2020 are nucleic acids, then introduction to biotechnology and organ function test. So rather than speaking all the topics, I will prefer to speak on the new topics which are very important, and these are new to anyone. So let's see what are changes made in the question paper pattern of our examination for both year 1991 and 2020. So if you can see on the left hand side, during year 1991 there were 6 questions. Okay, in that first question was small answer question or answer in one line, whereas in case of year 2020 you can find there are only 3 questions, but out of these 3 questions, 20 questions are like that of MCQ or small type of questions. So in year 2020 the question pattern is changed and it is quite simple as compared to year 1991. Next, see the topic of our importance, that is what sort of changes are made in the load of subject, that is biochemistry and clinical pathology. As far as theory lectures are concerned, in year 1991 there were 50 lectures, and in year 2022 the lectures are increased, that is nearly about 75 lectures will be there for this course. And as far as practicals are concerned, there were 75 practicals and now the practicals are reduced to 50. But along with that, in year 2020, 25 tutorial lectures are included. Means what? We should teach the syllabus in a very proper way. We usually do it, no issue at all. But more emphasis has been made on the theory lectures. Practical hours are reduced. So I think the tutorial section, rather than just teaching a specific subject or specific topic which is difficult to all students, I think so we should allot some sort of activity based learning, because it will be more beneficial for the students in understanding all the topics in and out. Next, let's see the very first topic, that is introduction to biochemistry. So in the introduction to biochemistry, I would like to say, being a lecturer, we should start from the definition of biochemistry, because many times what happens, students know each and everything about biochemistry, but they don't know the definition of biochemistry, their scope, their branches and all. So along with that, I think we should collaborate the use of biochemistry in pharma industry, because nowadays students are not only will be able to work as a pharmacist or a community pharmacist, but they are going to enter inside another industries. So they should have the knowledge of both. It means by use of biochemistry in pharmacy also. And the next is the cell and biochemical organization. Many times what happens, students usually go through the model answer sheets of the MSBT or any kind of exam, and they usually go through the topics which are usually frequently asked in the examination. They don't focus on the use of microtubules. They only focus on the definition of nucleus and mitochondria. So to make the topic interesting, I would like to add some sort of activity for the students. For example, after teaching this topic in our lecture, we can introduce one activity. We can assign some sort of assignment, that to design a tree diagram for the branches of biochemistry, so that these students now will try to read the books. Nowadays what happens, there are a number of publications which provide directly question answer to the students. So if you will ask students, kindly tell me the books or the authors for the book, they don't have any idea. So to prevent this kind of problems, to increase the reading activity, I think so we should give some sort of activities to students so that they will participate actively in the process of teaching and learning. So this is second activity. We can assign the use of biochemistry in our daily life, so that it will be more interactive for both teachers and students also. So I am audible, sir?
Yes, sir. Yes, sir.
Yes, sir. Yes, sir.
Now, next topic is carbohydrates. So as far as carbohydrates are concerned, students only focus on the definition, classification, and structure of the carbohydrates. So it's my humble request to all the faculty members and teachers, my mentors, if you will assign some sort of activity to the students, and we will give some idea, means what are the uses of carbohydrates, or not only the biological role, but if we will include the use of carbohydrates in daily life or in the industry, it will be very beneficial to the students. So as far as this topic is concerned, previously in the topic of carbohydrates, they had some reactions of carbohydrates like Osazone reaction, oxidation reaction, reduction reaction. So this chemistry part, I think so they have been removed in new year 2020 from the biochemistry and clinical pathology. More emphasis has been made on the biological role and metabolic pathways along with the diseases. So for this kind of carbohydrate topic, we can assign some activity like to isolate the starch and submit starch powder and mention its uses. So if we will give this kind of activity, they will really know what is starch, what are the two components of the starch, amylose and amylopectin. Okay, I will try to speak in Marathi language for this topic. कधी कधी असं व्हायचं लहानपणी की जेव्हा आई काही बनवायची चिप्स किंवा हे, तर तेव्हा आम्ही ते सर्व करायचो, म्हणजे बनवताना हे करायचो. ताई विचारायची, आम्ही विचारायचो व्हायला की ते वरती तो त्याच्यावरती सुपरनेटेंट लेअर जो आहे तो काय आहे चिप्स बनवताना, तर आई म्हणायची अरे तो स्टार्च आहे. तर अशा प्रकारच्या जर ऍक्टिव्हिटी आपण जर बघत राहिलो, ऑब्झर्व केल्या किंवा मुलांना सांगितल्या, तर त्या मुलांना कळेल की नाही हे कार्बोहायड्रेट आहे, स्टार्च आहे. आणि आपण बरेच वेळा स्टार्च हे जे आहे हे आपण फक्त बायोकेमिस्ट्रीचा त्याचा उपयोग न सांगता आपण स्टार्च हे डायल्युएंट फिलर्स किंवा ऍडिजिव्स म्हणून आपण ज्या फार्मास्युटिक्स मध्ये शिकतो याच्याशी जर आपण दोन सब्जेक्टचं कोरिलेशन करून दाखवलं तर मला असं वाटतं की ते फार योग्य राहील शिकायला आणि मुलांना समजायला पण. Then next topic is proteins. So as far as proteins are concerned, in year 2022, they have mentioned the definition, classification, and of both proteins and amino acids. But in this syllabus of proteins, I would like to say they had removed two topics. That is, denaturation of protein has been removed completely. But instead of that, they have mentioned the 4 basic levels of proteins. So what I would like to suggest, or what I think personally, is that if we will teach this topic in correlation with the pharmacology in the aspect of kidney, that is microalbuminuria. What is microalbuminuria? Why there is leakage of protein? What is the function of the protein? Nowadays, youngsters are more focused towards whey protein. So if we will explain what is whey protein and why it is necessary to take whey proteins in a specific quantity for the healthy life, so they will try to develop interest in our subject. So along with that, along with the proteins, or we can say all these basic points, there were few reactions in the proteins chapter, that is near-hadron reaction. So this topic of chemistry has been removed in this year 2020 by the PCI. So for this topic proteins, I would like to say we can assign one activity, as we know that the secondary structure of protein is most frequently asked question in the board examination. If we will ask students to develop and design a small model for secondary structure of protein, which is sheet-like structure, so it will develop some sort of it will use both psychomotor skills and definitely affective and motor skills will develop. Next, lipids. I think so this topic is very booming nowadays because of cholesterol. So I will talk about cholesterol later, but let's focus on the lipids. In the topic of lipids, the maximum course, or we can say maximum points which were there in year 1991 were same, but I think they had increased the points or discussion about lipoproteins, that is IDL, LDL, HDL, and VLDL. So we should also focus on these topics because they are ultimately correlated with the both pharmacology and pharmacotherapeutics regarding the cholesterol and hypertension. So basically what we do we only tell students acid value. It is usually asked for 1 mark, and they also mug up the definition of acid value. But instead of that, if we will conduct some activity in which we will allow the students to bring the samples or different samples of oil, and we will determine the acid value of the oils of different samples, obviously. And after that, we will tell that if the acid value will increase, then quality of oil will decrease. So such kind of correlation between the topic and the real life experiments will increase definitely increase the likeness of the student to the subject. Then this is a new topic in year 2020, that is nucleic acids. Although nucleic acids topic is already covered by the students in 11th 12th during biology, but they just now came here on the next step, that is a diploma pharmacy. So if we will tell them what is the benefit of nucleic acid, because they have already done with the structures in chemistry in first year. So if we'll elaborate what is purine, what is pyrimidine bases, what are their structures, how their assembly is made, and what are the importance of these nucleic acids in our body, or we can say human body, and if the nucleic acid sequence is changed, what will be the consequences. So if we will elaborate all these things, although there are only 4 lectures allotted to this, but definitely it will be helpful for the students. So there is one activity I would like to say, it will be best for the students to design and submit a 3D model of DNA. So in this case, there is a boy who has designed the same thing. He's not from our college. It's a just image from the internet, but we can do this activity. Then next is enzyme. As far as enzyme topic is concerned, for this year 2020, they had included the classification of enzymes. Initially, they had just classified the enzymes, that is OT Hill, but now they had elaborate the classification of enzyme according to IUB and MB. So I think before starting this topic of enzyme, can we start the enzyme topic with some sort of story? For example, in the preparation of idli, we need batter. Okay, so when the batter will get properly fermented, then and there we can eat or bake our idli properly, prepare our idli properly. So these kind of examples we can give. What is the importance of enzyme in preparation in a household life, or definitely in case of pharmacy? So it will increase the likeliness of the students in our subject. Then next topic is mechanism of action, because mechanism of action of enzyme is very, very important, because these catalysts, how this catalyst will work, what are the issues if these enzymes will not work. Then next is enzyme inhibitors. I think so enzyme inhibitors is very important topic, not only for the biochemistry but also for the pharmacology, because as we know, liver is the basic organ for the enzymes or hormones, we can say. So if enzyme inhibition occur, what will be the consequences of this enzyme inhibition? We can correlate both the subjects so that it will be easy for the understanding of the subjects. Then next is the pharmaceutical importance of the enzyme. I think so this is also very, very important, because student only focus on the focus on the model answer sheet which is provided by the MSBT. They only have that kind of idea. They don't go beyond that. So it's a duty of faculty members to know the different uses of enzymes, not in therapeutics but also in pharmaceutical industry, agriculture industry, so that they will develop the interest in all the aspects. So same activity can be given to the students. For example, we can assign activity to enlist the various enzymes which are present in our human body, starting from amylase till lipase. Then these 3 topics, that is vitamins, minerals, electrolytes and waters, these are topics which were there initially in the our year 1991. But what I think, these topics, all topics are given in only a written format, so that student basically bypass these topics. They only focus on the 4 cycles, 4 classification, that's all. So to make this topic interesting, I think if we will add this type of pictorial images, that is, for example, you can see on the slide physiological role of sodium in the body. So by viewing all these slides, I think pictorial memory is very good as far as the theoretical memory. So by giving such kind of slides, definitely we can increase the pictorial image of the students regarding the specific topic. Next, very important is the metabolism. So topic number 8 got 20 hours for the teaching and learning process. So this topic is divided basically into 4 parts. That is, first, metabolism of carbohydrates, metabolism of lipids, metabolism of amino acids, and biological oxidation. So it's my humble request to all the faculty members, mentors, if is it possible to cover basic cycles, that is glycolysis at the time of teaching of carbohydrate, so that what will happen when we will teach all the cycles at a glance, student will get confused, because they may write the content from glycolysis into urea into Krebs cycle. So to avoid that, if we will teach glycolysis at the time of teaching of carbohydrate, then it will be beneficial for the student, and at this time we can revise the cycle, so that we will totally focus on the glycogen metabolism and other disorders of the carbohydrate metabolism also. Then in case of lipids, lipolysis, beta oxidation of fatty acids, these are the repeated topics, but special emphasis has been given on ketoacidosis, fatty liver, and other things. As far as metabolism of amino acids are concerned, the reactions of amino acid, for example, anhydride reaction, this topic has been removed in year 2020, whereas further topics of this metabolism of amino acids are same. Next and very important topic is biological oxidation, that is electron transport chain. So when we will teach these topics, that is carbohydrates, proteins, amino acid, if we will show some sort of diagram to the students that when carbohydrate will get metabolized, protein will get metabolized, lipids will get metabolized through small chain reaction, then when they will go through the electron transport chain, we will get ATP. What basically happens when student learn all the topics in a different time format, they didn't get an idea how these topics are interlinked. So if you will interlink all these topics, and ultimately through the ETS we will get the ATP. So it will be beneficial for the students for better understanding. Then oxidative phosphorylation. This is also one of the good topic which is included along with this electron transport chain. So basically, respected faculty members, my learning memory is not up to the mark. That's why I had prepared some mnemonics for proper understanding of the glycolysis cycle, Krebs cycle, urea cycle. So can I share one mnemonic for the glycolysis if time permits?
Sure, sir, sure.
Yes. So for remembering all this pathway, first is good. Ganesh father failed. Did Gauri buy 3 and 2 pen drives? So this kind of mnemonic will help the students to remember this pathway in a very basic way, because mugging process, it is very difficult to one and all, and it is also common for the students. So by using this kind of mnemonics, we can increase the learning memory, and definitely marks will increase. Now the new topic in our syllabus is Introduction to Biotechnology. For this topic only 1 hour is allotted, so it's very difficult to merge all the basic topics in the biotechnology, but I would like to share, if we will include these 3 to 4 points in our presentation, it will be beneficial for the students. First, we should I think so we should give some idea or basic definition about the biotechnology. What are the scope, what are the importance of biotechnology? Then we should include the classification of biotechnology, and of course the application of the biotechnology. And along with that, if we will discuss the new topics, that is RT-PCR. We had gone through the RT-PCR testing during Corona session, so it will be helpful for the proper correlation of the subject. Then last on a very important topic is Introduction to the Pathology of Blood and Urine. So in the pathology subject of blood and urine, it belongs to clinical pathology part, of course. in this case, if we will merge this topic or if we link this topic from the anatomy and physiology, then it will be beneficial for the students, because in case of pathology, as we know, we have assignments also. That topic will be discussed by Dr. Argade sir. But in case of assignment, if our student know basic pathophysiology of the disease, pathology of blood and urine, and basic components of the blood and urine, both in case of abnormal and normal, it will be beneficial for the proper understanding of the topic in a broad way. So for that, I have designed one activity. So we can tell students to prepare and submit a case study on the malaria or anemia patient with the valid clinical reports, and they should report the following points, that is pathological reports, symptoms, treatment, standard parameters, conclusion. So if they will perform this kind of assignments or activity, definitely student will get a proper idea or thorough idea about the diseases. Last but very important topic, that is organ function test. As we know, it's a part of clinical pathology, and three basic organs, or the organ function test of three basic organs are mentioned over here, that is kidney, liver, and lipid profile test. So prior to starting of the kidney function test, if we will discuss what is the structure, what is the function, what is the importance, what is the working of the kidney, what are the basic tests which are present for the kidney function test, what are the basic parameters, and what will happen if the parameters will change. So in elaborative way, if we will discuss each and every function test, so it will be beneficial for the students, because many a times what happens, student know about the diabetes mellitus, but they don't know about HbA1c. What is what is the parameter for preprandial sugar, postprandial sugar? These topics are not known to the students. As we know, the topic is more patient oriented. So if we will teach in this way, so that students will have elaborative idea about the topic and all the things. So liver function test, kidney function test, and lipid profile function test are very crucial nowadays. So it will be beneficial for the students for the proper understanding if we will cover these topics in a very proper and thorough manner. So this is small activity for the students. And now the last topic is the references. As far as the ER 2020 is concerned, these two books are recommended by the PCI, that is textbook of Biochemistry by Ramarao and Satyanarayana. But I had gone through number of books, that is AC Deb, Ramarao, and Satyanarayana. But along with that, I found the book of Biochemistry and Clinical Pathology by Kuntal Das. It was a nice book, definitely. I think so. It is elaborative also. It is very good book. So I would like to share my thoughts that it is very friendly book for the students. So thank you for the patient listening. Sorry for technical glitch.
No issues, sir. Thank you. I guess that clarifies many things about the theory part of the BCP. But I guess we'll continue with the session, and I'll ask Ragade sir to take the practical session, and then finally we can discuss the questions about theory and the practical together. Is it okay, sir?
Yes, sir. Fine.
Yeah, Ragade sir. Yeah, Marade sir. And okay, sir.
I think my screen is visible to everyone now.
Yes, sir.
Okay. So let me ask one question to everyone. Dear participants, rather than the respected teachers, how much percentage of your results of second year chemistry or first year chemistry in your institutes? Yes, be attentive, be responsive in these sessions. I will share my results of my pharmaceutical chemistry 2 result is near about 78%, and overall result is 43%. So overall my second year result is 43%, and the result of pharmaceutical chemistry is near about 78%. So now tell me yours. Thank you, Aarti ma'am. Only one participant is attentive. No one want to share their results. Okay, Amol sir, very thank you. We have 138 participants, teachers. So if you are not showing the interest, if you are not taken part in the discussions, then it will be really, what I can say, I'm unable to recall that word now. Okay, Rushali ma'am, 88% for SVKM, Tosh Patil. Okay, that's good. SK Shilsagar, very poor, sir. Okay, very poor, very poor. That's good. Very low in chemistry. That's correct. Why I'm asking these questions to you, dear respected teachers? Because overall PC results is very low, in all over the Maharashtra, because the approach of the students towards the chemistry is somewhat different than that of the approach of the students for other subjects. And I think so, it's my personal view, somewhere we are responsible for their attitude, for their approach towards the chemistry. Every time we have just given the bombardment on the students that the chemistry is very hard. Chemistry is very hard, isn't it? And the pass out students or the seniors, some of the classmates, they are also responsible to make such a impressions about the chemistry, isn't it? And now what happens this year, the pharmaceutical chemistry for first year and pharmaceutical chemistry for the second year results are too much of down. So everywhere, whenever I talk with my different friends, different teachers, they told me that this year we are not getting the good results. So ultimately we are sending one message to the first year student that yes, you have to study very seriously about the chemistry, because last year the result of chemistry is this. So the students will enter into your institutes with that impression the chemistry is a very hard subject. So dear faculty members, I think there are some principles are there in this meet. So I really want to request all of them. It's our duty, it's the teacher's duty. Try to give the positive impressions on the chemistry or biochemistry. Because if you are able to give the proper impressions, proper attitudes towards the subjects, definitely it will help the students to get the more results. That's why I'm sharing one things with you, that my subject this year second year result is the near about 80%, and overall second year results in my institute is 43%. Means the most of the students are able to cross the 40 marks in pharmaceutical chemistry too, but at the same time they are not able to get the more marks in other subjects, isn't it? Why? Because whatever the activity based suggestions given by the Marathi sirs, I really appreciate his efforts, because if you correlate your syllabus with daily life and ask the students to do that, I know there are 60 students in our class. All are not listening to us, but at least 50% students will listen to us. They will try to find out the really the teachers are told that much is responsible or helpful in our day-to-day life. They are going to check into the medical shops. They will start to study the whatever the drugs are available in the markets, and after that they will getting the knowledge. It's very, very important. So in second session you are learn about the community pharmacy, isn't it? So if the students are very well aware about the biochemical parameters, how it's related to our clinical pathology, really it will helpful to our students to do a proper patient counseling. Because you know very well the number of medical shops are increasing day by day, and after some years you will find out that only the some medicals are able to have a good business. Why? Because they are able to do the patient counseling. Because nowadays the patients are also educated one. They want the proper informations about the drugs and disease from the pharmacist also. So it's our role to make the competent pharmacist. It's our role to make them aware about each and every things correlate with the real life examples. That's why already Marathe sir told the last 2 activities are assignments. You ask the students to visit the pathology laboratories, collect the reports of concerned patients of specific disease, and try to correlate their parameters with the disease symptoms and conditions, and how to improve that parameters. It will really helpful in the pharmacotherapeutics theory and practicals also. So these subjects are interconnected, and you have to just try to give that particular interconnections to the students. Really, it will helpful. I think so. It is just my suggestions, and really, I want to give some practical aspects to each and every student, so they will really help you to improve their knowledge. Ultimately, it will help them to improve the results. Rather than improving the results, they will be a very competent pharmacist. If they are started their own medical shops or go into the higher educations or go to the jobs, it will really helpful to you. So dear faculty members, here I am not going to share you how to conduct the practicals, because already this biochemistry and clinical pathology subjects is there in year 1991, and some of you are having the more experience than me. So you know very well that how to conduct the biochemistry and clinical pathology practicals. You know very well. So I'm not going to tell you that you have to take the test tube and ask the students to do that test and do that practical like that. No. So here I am just sharing the something new aspects about the practicals, and I think so it will be helpful to you. Okay, so let's start with our session now. So as far as the PCI or year 2020 is concerned, the subject name is Biochemistry and Clinical Pathology Practicals. I think now you all are aware about there are 10 subjects. Now for the second year, there are 11 subjects, isn't it? For the students, theory subject is a different and practical subject is a different. And as far as PCI is concerned, it has given the separate code, and in PCI syllabus, the code for practical is given is ER 2023P. And as far as the MSBT, the subject code for this practical is 20058. And as far as the teaching hours is allocated for the biochemistry is 2 hours per week. Previously it was 3 hours per week, but now it's 2 hours per week. So we have to finish our experiments within 2 hours, because we have to finish up these experiments or finish up these practicals and go to the theory and tutorial, because we have too much of loads now, isn't it? So we have always, whenever there is a new syllabus, new thing is there, there are some questions in the mind of teachers, but I think there will be no questions in case of biochemistry, because we know very well the biochemistry is already we have studied during our graduations, post graduations, and already we are teaching that particular subjects since from the last many years. So I think these 3 questions in not in your mind in case of biochemistry, but it is these 3 questions in your mind in case of community pharmacy, in case of pharmacotherapeutics. So it will really help to you how to start, from where to start, and what to do. So every time you have to start along with the practical outcomes or outcomes. What are the outcomes frame given by the PCI? First, you have to read it. First, try to understand it, and then try to divide your subjects, divide your content of the syllabus into the outcomes. Try to think how we are going to achieve that outcomes. If you're getting the answer for that particular questions, really it will help you to implement the new syllabus in your day-to-day teaching and learning process. So there are 2 outcomes. First outcome is qualitatively determine the biomolecules, that is carbohydrates, proteins, etc., or metabolites in a given biological samples, that is either urine or blood. So first practical outcome is nothing but the qualitative analysis. Okay. Second outcome is determination of normal and abnormal constituents in the blood. Determination, that is we are going to quantify. So that is the quantitative analysis. So qualitative analysis and quantitative analysis. And on that particular basis, students are able to interpret the results of such a testing. They are able to correlate that particular pathological conditions. They are able to correlate that report with the symptoms of the patients. And that will really helpful to them to plan the treatment, isn't it? So it will really helpful if you correlate each and everything with the pharmacotherapeutics. So it will really helpful to the students to get some more knowledge along with the biochemistry. They will get the good knowledge about the etiology, pathophysiology, and the treatment of the diseases. It will really helpful them into the pharmacotherapeutics also. So always try to think how we are going to attain that particular practical outcomes. So as far as the practical outcomes are concerned, or as far as the syllabus given by the PCI is concerned, I have tried to cover these two practical outcomes by framing the 25 experiments. So this is my plan to complete the 25 weeks of this biochemistry, that is 50 hours per year, isn't it? So first practical, introduction to biochemistry, then experiment number 2 and 3, we try to keep with the calibration of the glass apparatus, because student must know how to handle the glass apparatus and how to calibrate them. And then qualitative analysis for the carbohydrate, that is 4 experiments. Then qualitative analysis for the proteins for that 2 experiments. Then qualitative analysis for the amino acids for that 2 experiments. Then qualitative analysis of the lipids, identification test for the cholesterol. Then go for the normal constituents of urine for the qualitative analysis. Then for abnormal constituents, conduct the 2 experiments. Then quantitative analysis of glucose in a urine sample, quantitative analysis of creatinine in a urine sample. And from the experiment number 20 to 24, these are the quantitative analysis of different biomolecules in the blood sample or the serum level, that is estimation of creatinine, glucose, like that, isn't it? Thank you, Kiran sir or Kiran ma'am, I don't know, but thank you very much. You got very impressive results. I really want like to congratulate you, and if time permits, just share your success story with us. We really want what you have did for getting this kind of the results. It's really impressive. It's really appreciable. Just share your good practices with us. So it's really helpful to us to implement in our teaching and learning process. Okay, so please share. Aditya sir, at the last, please allow him or her to unmute. Okay.
Sure, sir, sure.
Okay, thank you. So, to attend all these 2 course outcomes given by the Pharmacy Council of India, we have to conduct the 25 experiments, and already the list of experiments given by the Pharmacy Council of India. I have kept these things in our mind, and we have tried to develop one laboratory manuals. Already you know that the MSBT is not going to supply the laboratory manuals, as they are not prepared the manuals as far as the new syllabus is concerned. And I think yesterday only they have released one circulars. Some of the lab manuals are available on MSBT websites, but they have issued that circular for the AICT approved institutes. So for the polytechnic institutes, not for the pharmacy institute, because they have not prepared that particular manuals. So already you know the authors of that particular manuals now, isn't it? So what are the salient features? What things we have kept in our mind to design these manuals? Most importantly, we have tried to cover all the points given in the ER 2020. Most importantly, all the authors are renowned. I think one of the author you have met in the second session, that is Dr. Dias sir. I think you have met him. Okay. Another author, I think myself, and the third author is the Dr. Sushant Pandey sir. He is the lecturer from the Government College of Pharmacy, Karat. We have tried to keep this manual as simple as students can able to understand the language, isn't it? They can able to get the things very properly. They can able to perform the experiments by following the procedures, and they can able to note it down their observations and the results, and there are sufficient spaces available for the recording of each and everything. And most importantly, when we talk about the OBE, I'm not going to advertise my manuals, but if you have such a documents, it will really helpful to you to implement the OBE, and that will helpful to your institutes to get a good gradings or rating in external academic monitoring. I think most of you have know MSBT are going to conduct every year the EIMC, External Institute Monitoring, or we can say the academic monitoring, and where the curriculum implementation aspects carries the 10 marks for the department levels. Curriculum implementation aspects. How many marks are there? 10 marks are there. So dear faculty members, we have tried to map the each and every experiments with the program outcomes given by, with the course outcome given by the PCI and the competencies given by the PCI. Each experiments we have tried to map. So I will show you the one of the experiments. Okay, so this is the one experiments, that is experiment number 14, qualitative analysis of urine for normal constituents. Here we have started with the aim, then practical significance. What is the significance of that particular practical? After performing that particular experiments, what students will learn? Okay, and then you can see here the relevant professional competencies. So this experiment, after completion of this experiment, that is experiment number 14, students are able to address these 4 professional competencies listed in the ER 2020. That is PC3, 3 numbers competencies. Provide the patient counseling. Yes, students will be able to provide the patient counseling after the performing the urine analysis. Expertise on medications. Yes, if you know the what actually happened with the students, so it can give the expertise advice on the medications also. Even he can able to deliver the primary and preventive health care to the patients. Yes, after knowing the urine analysis, report of urine analysis or content of the urine, he can able to do that the things, and most importantly the continuing professional development. So we have tried to give the mapping of each and every experiments with the professional competencies and which relevant course outcomes will be achieved after performing these experiments. हे लक्षात घ्या शिक्षकांनो, शिक्षक मित्रांनो, की आपण जर विद्यार्थ्यांना हे जर सांगितलं की हे प्रॅक्टिकल तुम्ही केल्यानंतर तुम्ही हे प्रॅक्टिकल केल्यावर तुम्हाला ह्या गोष्टी समजणार आहेत, हे जर आधीच समजलं तर थोडं ते त्यांना प्रॅक्टिकल करण्याला उत्साह निर्माण होतो. सुरुवातीला जर काही गोष्टी माहिती असतील का हे केल्याने हे साध्य होतं तर विद्यार्थी ते करण्याकरता इच्छेने स्वच्छेने सहभागी होतात आणि मग हळूच आपल्याला कुठेतरी याचा फायदा आपल्याला अकॅडमिक मॉनिटरिंग मध्ये काही इन्स्टिट्यूट जर एनबीए ला जात असतील तर हे डॉक्युमेंट सुद्धा एनबीए साठी खूप युजफुल ठरणार आहेत त्यांना. पुढे जाऊन मी तुम्हाला एक एनबीएचं क्रायटेरिया 2चं पेज दाखवणार आहे, त्याच्यामध्ये तुम्हाला हे कसं उपयोगी ठरेल हे एक मी तुम्हाला सांगणार. म्हणजे ठीक आहे तुम्ही मॅन्युअल घ्या नका घेऊ तो प्रश्न आहे, पण जर तुम्ही प्रत्येक एक्सपेरिमेंट प्रत्येक थेअरीचं लेक्चर जर आपल्या ह्या प्रोफेशनल कॉम्पिटन्सीज आणि त्या सब्जेक्टच्या कोर्स आउटकम बरोबर जर मॅप करून ठेवलं आणि त्याचा रिझल्ट जर तुम्ही नोट डाऊन डॉक्युमेंट जर करून ठेवलं, सो डेफिनेटली इट विल हेल्प यू टू गेट द मोर मार्क्स इन द external academic monitoring. That is very useful because there are 10 marks and if you get the 10 out of 10 it will really improve your ratings. If you are getting the very good grades you will be able to achieve the excellent grade, because every institutes are really want the excellent grade in the academic monitoring, because during admission process you everyone want to display their results in the external academic monitoring, isn't it? So that will be really helpful to you. Okay, then practical skills. So what the skills students will learn after performing these experiments, what are the learning outcomes of that particular practicals, and then what are the affective domains they will get from the after completion of these experiments. Likewise, we have mapped everything with the in our manual, in our experiments. Then students have sufficient space to note down their observations and give the write the answers of questions in the space provided. Yes, we have giving some space over there. Students have to perform the practical. Most importantly, everywhere we have given some activity or directly the experiments. Student has to write something, student has to do something, then only they can able to write down the something, isn't it? It doesn't like that something theory part is given and then lastly you have to just write down the conclusion, this is the studied and understand. It is not like that. There is something in this manual. Students has to do the experiments, do something, some activity, solve the questions according to that particular activity, then only you have to give the marks to the students. So effective learning is guaranteed through the conceptual understanding and the stepwise procedure. Yes, we have given all the things. As I told you earlier that if you map everything with the course outcomes and program outcomes with each and every activity, then you will be able to give the more and more marks in the criteria 2 of NBA, because I think most of the institutes wants to go for NBA now. At least I think 132 participants are there. At least 30 participants are working on NBA process now. I think so. It's my assumption, isn't it? Yes or no? So dear faculty members, see here, the delivery of syllabus content and compliance of the curriculum, 5 marks are there. In that, laboratory experiments are there. So how you are going to document the conduction of the laboratory experiments is very, very important. And as the Marathe sir told that you have to assign some activity why to fulfill the curriculum gaps in our curriculum. There are some curriculum gaps is there. Try to identify the gaps and assign some activities to the students. Ask them to go to the pathological laboratories. Ask them to go to the medical store. Ask them go to the hospital, isn't it? So it will really help you to learn something new things from the real life examples, because by just giving some notes, by giving some presentations to the students, they are going to their homes and rooms, they are just mugging it and they are appear for the exam. It doesn't like that, because nowadays I think you know the paper pattern. 20 marks is for the short answer type of questions, or the one-word answer type of questions, or the filling the blanks type of questions. So for the preparing to the students, isn't it, we have to give some extra activities to the students so they can able to gain the knowledge, they can able to attain all the questions in question number 3. Okay, this is the very important. Now, most important, the initiative in teaching and learning process carries 15 marks in the NBA process. In that, the sum of the points has been given to the quality of laboratory experiments with regards to conduct, record the observations, analysis, and continuous evaluations. On the basis of the laboratory experiment assessment, because we are maintaining the day-to-day assessment format, isn't it? Because we are doing the analysis of the students by taking the vivas, by checking their manuals in every practicals, isn't it? That is the continuous evaluation, and that documents is really important. And on that particular basis, on that particular evaluations, you are able to distinguish them between the slow learners and the fast learners, or bright students and the weak students. And on that basis, you have to assign some different activities in the tutorial hours, because tutorial is there now, isn't it? Tutorial are specifically given in our syllabus now. So don't call the bright students in the tutorials. Call the weak students for the tutorial some days. Try to implement some cooperative learning strategies, or the flipped classroom strategy, or different teaching learning strategies for the assisting the weak students. So you have to take the extra efforts in the tutorial hours for the weak students. And dear faculty members, you have a specific mechanism to distinguish them between as a bright students and weak students. So for that purpose, these manuals or these experimental assessment technique will help you to distinguish them between the bright students and weak students. So just take a tutorials of the weak students, one-to-one interaction is there, ask them where they are finding the difficulties. Some of the call the bright students, ask them to share their success story with other students. It will really help to improve their learnings, isn't it? असं केल्याने काय होईल की थोडं विद्यार्थ्यांना लर्निंग मध्ये थोडा इंटरेस्ट निर्माण होईल, आणि मग ते कुठेतरी आपल्या फ्लो मध्ये ते येतील, म्हणजे आपल्या सब्जेक्टकडे ते थोडे अट्रॅक्ट होतील, आपल्या सब्जेक्टचा ते अभ्यास करायला सुरुवात करतील, आणि मग कुठेतरी आपल्या विषयाचा निकाल चांगला लागेल कुठेतरी विद्यार्थ्यांना नॉलेज चांगले मिळेल आणि मग त्याचबरोबर याचं जर तुम्ही प्रॉपर डॉक्युमेंटेशन जर केलं तर हीच गोष्ट आपल्याला अकॅडमिक मॉनिटरिंग मध्ये पण आहे की व्हॉट आर द एफर्ट्स टेकन टू इम्प्रूव्ह द वीक स्टुडंट्स. सो त्या पॉइंट मध्ये पण तुम्हाला मार्क मिळतील आणि इकडे एनबीए ला पण त्याचा मदत होईल. म्हणून हे डॉक्युमेंटेशन प्रॉपरली करा की जेणेकरून आपल्याला एनबीए करण्याकरता किंवा अकॅडमिक मॉनिटरिंगच्या याच्याकरता आपल्याला याची मदत होईल. म्हणून मी तुम्हाला सुरुवातीला तेच सांगितलं, आय एम नॉट गोइंग टू टेल यू हाऊ टू कंडक्ट द प्रॅक्टिकल. सिलेबस बदलला म्हणजे आपण शिक्षक आहोत, आपल्या सर्वांना माहिती आहे की प्रॅक्टिकल कसं घ्यायचंय. फक्त आपण जे घेतोय ते फक्त एका विशिष्ट डिरेक्शन मध्ये घ्या की जेणेकरून आपण एनबीए किंवा अकॅडमिक मॉनिटरिंग असेल किंवा विद्यार्थ्यांचा गुणवत्ता वाढीचं जे काही आपल्याला करायचं असेल त्याच्यामध्ये आपल्याला त्याची मदत होईल. Now initiative related to the hospitals and other related interactions, 10 marks are there. And our assignments for the biochemistry is what? The interactions with the different pathological laboratories. We don't have the field visit, but we have the assignments, and each assignment for one sectional. Means each student have to complete the 3 assignments. Means throughout the year, one student have to visit one laboratories, one pathology laboratories. They have to collect the pathology reports, either blood reports or urine reports. So give them a specific disease. So it will help to correlate your biochemistry with the pharmacotherapeutics also. It will help to have interactions with the other institutes or other laboratories. It's nothing but what? That is the industry for us. Industry means it is nothing but the go to the pharmaceutical industry. Hospital is the industry for us. Pathological laboratory is industry for us because they are the outside from our campus, and it will really help for us to improve the teaching and learning process, isn't it? So if you have this vision in your mind, this thing in your mind, really it will help you to improve your grading in the external academic monitoring as well as the MBA process. So this is how you can able to implement the biochemistry practical to improve the marks each sub criteria of criteria 2 in NBA process and curriculum implementation aspects in the external academic monitoring. Okay, so what are the features of this manual is what? We have divided it into the 5 sections. First section is the introduction to biochemistry, then the qualitative analysis for carbohydrates, then qualitative analysis for proteins and amino acids, qualitative analysis of the urine, and quantitative analysis of the human bloods. Okay, we have designed it for the outcome based educations. Already I have explained the things. Each experiments have mapped with the CO, PO, practical skills and learning outcomes. Each experiments are arranged in the uniform way. Each and every experiments are arranged in a uniform way, definitely. We have given the safety guidelines and precaution in each and every experiments. And most importantly, we have given the rubrics for the assessment of that particular experiments, isn't it? So in the initial stage, we have given the mapping of course outcomes of each and every experiments. In each experiments, we have given these experiments are correlated with that particular CO, but in combination, we have given these tables. So experiment number 1 addresses CO1 and CO2. Experiment number 11, that is qualitative analysis of amino acids, it will address or it will able to attend the CO1. That is the qualitative determination of biomolecules. Like that, we have given this mapping table. So it will really help you to do the attainment calculations for the external academic monitoring purpose. So already we have discussed the experiment list. So I think there is no need to discuss the things. But most importantly, you have to give some this kind of summary sheets to the students. So if you give this table to the students, students will be able to perform the qualitative analysis of carbohydrates. So this table or this chart or this scheme is for the qualitative analysis of carbohydrates. So you are the teachers, you are able to create such a summary documents or summary charts, prepare it and share it with your students. We already prepared that charts and we have incorporated in our manual. Similarly, we have prepared for the proteins and amino acids also. Then you have to conduct some experiments on the qualitative analysis of lipids and cholesterol. Then qualitative analysis of urine for the normal constituents and abnormal constituents. Already these practicals were in the last syllabus also, last year also. So there is nothing new, but we have make some summary of the normal constituents as well as abnormal constituents. And then we have to perform this quantitative analysis of the bloods. And most importantly, the rubrics. Rubrics has been given, and this rubrics has been divided into 3 skills. That is intellectual skills, motor skills, and affective domains. So if the students having the good understanding, they will get 2 marks. How they have performed the experiments, you have to give some marks out of 4. And how they have performed the practicals, how they have maintained the cleanliness, how they are handling the equipments and apparatus, all these things you have to observe it, and you have to give the 4 marks. Okay, sorry, 3, 3, and then YY is 2. 3, 3, and YY is 2. Sorry, I have made a mistake here. And YY was for the 2 marks, so out of 10. So you have to maintain this document, because this is really helpful for the continuous assessment process or day-to-day format. We have to maintain it. It is very much important now. Why? Because now we have to give the out of 10 marks for the sectionals, for the manual records or the experiment records. So for that purpose, you require the continuous assessment process. And after that, we have some assignments. So we have to arrange some visits to the various pathology laboratories and ask the students to study that particular lab reports. And after that, most importantly, you must have some formats with you. We have designed these formats, and we have incorporated whatever format on your screen now. We have incorporated this format in our manual, because what happens, we know we have to conduct the practicals for 80 marks now. Each sectional we have to conduct the 80 marks. Out of 80, the 10 marks is given for the manual records or the laboratory experiment record, isn't it? Already you know the schemes of the sectional examination for the practical. I am not going to tell, because already the documents is with you. Already you have implemented these things in last year for the first year. So I am not going to discuss that things. But if you have this one table, that is practical record marks with you, definitely will be help you to whatever the marks is given in this column, it will directly shifted on your sectional paper, isn't it? On practical sectional paper, you have to directly convert or shift that particular marks on sectional practical paper. So out of 80 will be calculated, then convert it into the 10 marks out of 10 and make average, and then add the assignment marks. So what table says? The sectional exam, how many experiments are conducted during the first sectional period, during the second sectional, and during the third sectional. Suppose you have conducted experiment number 3 to 8. So total number of experiment conducted is 8. Okay, and average marks obtained for the experiment conducted out of 10. Suppose students will get the 72 marks for out of 80. So just write down 72 divided by 80 is equal to 9. So 9 marks students will get, and shift that 9 marks to on your sectional paper. So do it for the second section, do it for the third section. Then write down the sum marks of the assignments, because students have to complete 3 assignments for the biochemistry. Now for the biochemistry, there will be no field visit. It means that you have to give the 10 marks for the assignment, because as far as the ER document is concerned, we have to give the 10 marks for practical, 5 marks for the assignments, and 5 marks for the field visit. But dear faculty members, if the field visit is not there, you have to give the more weightage to the assignments. So for the assignments, you have to give the 10 marks. So very simple format: title of assignments, marks out of 10, signature of student, signature of evaluator, that is teacher, and assignment marks average of 3. Now here I have given some mark, isn't it? That is hashtag. It means what? Marks should be transferred from the appendix 1A, typical format for assessment of an assignment. Already this format is given by the PCI. See here, this format is given in ER 2020 documents. So I have just make one small changes in that particular format, because this format is for the 25 marks. You can see here, you have to rate each assignment of the students on the scale of 5 to 1. That is excellent, very good, good, satisfactory, and poor. Relevance with the content. You have to give some score here, 1, 2, 3, 4, or 5. And at last, you have to make the addition here. So whatever the score students will get, it is out of 25. But as far as the biochemistry is concerned, we have to convert the assignment marks out of 10. So dear faculty members, whatever the students will get the marks here, you have to convert it into the out of 10. I have seen some of the assignments, some of the institutes during the external academic monitoring, or when I visited somewhere during the lectures. That time we have discussed the things. Some of the teachers directly put out of 5, 3 marks, out of 5, 2 marks directly. If suppose your NBA visit or the external academic monitoring visit will there, and they will ask where this appendix 1, because as far as appendix 1 rubrics is there, and you have to follow these rubrics, you have to give the ratings on that particular scales. आपल्याला ह्या स्केल्स वर त्याला रेटिंग करायचं, म्हणून ह्या विषयाकरता आपल्याला फील्ड व्हिजिट नाहीये, म्हणजेच आपल्याला असाइनमेंटला 10 मार्क द्यायचे आहेत, 10 पैकी द्यायचे आहेत. आधी ते 25 पैकी देऊन घ्या आणि मग ते 10 मध्ये कन्वर्ट करा. त्याचा जो काही स्कोर इथे येईल पहिल्या सेक्शनलचा, तो या ठिकाणी शिफ्ट करा. सेकंड सेक्शनचा स्कोर येईल तो या ठिकाणी शिफ्ट करा. थर्ड सेक्शनचा स्कोर येईल या ठिकाणी शिफ्ट. म्हणून ही जी असाइनमेंट, ही जी काही अपेंडिक्स 1 दिलेला आहे, ओके नाही, हे अपेंडिक्स 1 आपण विद्यार्थ्यांना त्याच्या असाइनमेंटवर स्टिक करायला लावायचं. म्हणजे हे पेज त्याला आधी असाइनमेंटवर वरती लावायला सांगायचं, कारण सगळी त्याच्यामध्ये इन्फॉर्मेशन पण येते, या ठिकाणी त्याचं स्कोरिंग पण येते, आणि मग ते आउट ऑफ 10 कन्वर्ट होईल. जर फील्ड व्हिजिट असेल तर तुम्ही सेम फॉर्मॅट यूज करू शकता, फक्त या ठिकाणी आउट ऑफ 5 तुम्ही जर केलं तर ओके. मग या ठिकाणी तुमचा एक टेबल अजून वाढेल. हा टेबल 1 प्रॅक्टिकल रेकॉर्ड, टेबल 2 असाइनमेंट मार्क्स, and table 3 field visit marks. So depending on the subjects. Okay, so this is the all about how to implement the new syllabus in outcome based format. So I am really thankful to the organizers. I am really thankful to the all dear participants, because since from the morning you are in a meetings, isn't it? I know since from the last many days you don't have these habits to be a online in these meetings, because we have started our offline education since from February, isn't it? बऱ्याच दिवसापासून आपल्याला कोणालाही सवय नाही, तरी पण तुम्ही सर्वजण उपस्थित राहिलात, शांत चित्ताने ऐकून घेतलात, त्याबद्दल मी खूप खूप तुमचा सर्वांचा आभारी आहे. मी ऑर्गनायझर, विशेष करून आपले एपीटीआय स्टेट ब्रांचचे प्रेसिडेंट डॉक्टर सोमानी सर आणि त्यांची ऑर्गनायझिंग टीम आदित्य सर यांचा मी आभारी आहे की त्यांनी मला हा प्लॅटफॉर्म उपलब्ध करून दिला, आणि जे काय आम्ही गुड प्रॅक्टिसेस फॉलो करतो त्या तुमच्याबरोबर शेअर करण्याचा मी प्रयत्न केला. निश्चितच काही तुमचे सजेशन असतील तुम्ही मला पर्सनली सांगू शकता, हो की नाही, काही इश्यू नाही. यू कॅन जस्ट व्हॉट्सअप मी भाग्यश्री मॅम, आय विल शेअर दॅट पर्टिक्युलर स्लाइड, नो इश्यू.
Sure. Thank you so much, sir. So it's our pleasure to have you on board as always. And now, if you have any questions, you can put it in the chat box. But I guess the slides and everything was so explanatory, self-explanatory. Many of them won't be having anything. So we'll just wait for 2 minutes. Otherwise, we'll close the session for today.
Just unmute that particular one number is there. Okay.
Yeah.
Unmute them. 8258.
Yeah, you can unmute yourself. Yeah.
Good evening, sir. You can hear me?
Yes.
Yeah.
Okay, sir. I have one doubt that when you are putting the sessional marks, sorry, not sessional mark, when you are taking a sessional exam, at that time the journal marks we are putting in the answer paper. That is, and then that it becomes out of 80.
Yes, ma'am.
There is only one that suppose the student is absent.
For
in
whole period? For
no. For the sessional exam, suppose he is absent.
Okay.
Then he so many experiment marks. How to put it in the general mother register? Because what happens now, for the first year we experienced that suppose one student is absent, then what happens is in the mother register that word absent will not come, because journal marks we will have to put it. How do you solve this problem, sir?
As far as my knowledge is concerned, or as far as my understanding is concerned, if the students will remain absent for the practical exam on the day of practical exam, definitely he will get 0 marks. Or you can just put the AB or absence, because if you are not appeared, he or she is not appeared for the examination, don't consider his manual marks, because for the synopsis, for other things, all the marks are 0. So don't consider it. There might be a good discussions, those who are the senior member present over here, because if he or she is present on that particular day, then only we have to consider their manual marks. If he or she is not attending that particular examination, it means that he or she is absent. So just you can't put the 0, but just put the absent marks on your.
So then, sir, for whatever 8-9 practicals that person has performed,
yes,
his or her marks are not showing anywhere in that case. Those marks are gone forever for that.
Yes. For getting the benefits of that experiments, he has to remain present for the practical examination.
Okay, sir.
Okay.
Okay, thank you so much.
And one more point into that, ma'am. Anyways, we are considering best 2 sessional marks. So if he's remaining present for the rest 2 sessional, so he'll be, those marks will be considered into his final examination.
No, that I understand, sir. Only thing is, uska average of पहले कैसा था कि 25 experiment का average used to be there. So that I was just asking.
Okay.
Rupali ma'am asked sorry, she has asked some questions. Sir, what is the role of day-to-day assessment marks in conversion of 80 marks? Already, ma'am, I think if you see the guideline document of the year 2020, that is the breaking of the 80 marks in a practical, out of 80, 10 marks weightage is given in the practical record marks. So you have to just note down how many experiments you have conducted during the first sectional or second sectional period, and you have to make the average of that and just added that 10 marks into your final marks. Is it okay, Rupali ma'am?
Yeah, I guess she has replied with yes, sir. Yeah, any more questions? Okay.
Bhagyashali ma'am has sent one message to me. Sir, keep there is common format for all pharmacy institute, so not facing any issues. Yes, we have tried our best to maintain these formats commonly, but many of the institutes already design their own formats and they have started to use. But as far as the PCI is concerned, you have to stick up with the PCI formats, isn't it?
Yeah. Otherwise, it would be null and void.
To issue the number of formats to us.
Yeah. So I guess the questions, there are no further questions for today's session. So thank you so much, sir, for being present here today and obviously the participant. Thank you so much. We all know that today is Raksha Bandhan and everyone is there here since morning. But we couldn't find any better date for the FDP. So as Prashant sir is also knowing that. So thank you for the last session, Shrish Marathe sir and Prashant Daragade sir. To all the participants and from D.Y. Patil University School of Pharmacy, our principal, Dr. Rakesh Somani sir, wasn't there. He was busy somewhere else due to university work today. But tomorrow he'll be here, and we expect the same response as today for tomorrow's session. For tomorrow's session, you have to click the same link again. I'll be putting the message into your WhatsApp group that you have joined. And for tomorrow only, we'll be taking the feedback for all both the days, and then you'll be receiving the certificate after filling the feedback form. Yeah, sure. So thank you everyone. Shall I close the session, sir?
Yes, sir. Thank you very much once again.
Thank you, sir. Thank you, Shrish Marathe, sir. Thank you. Yeah. So I'm closing the session.
Sir, 1 minute.
Yeah.
There is one participant in our Kiran is there. Kiran is there, who has secured the 100% result in PC and PC2.
Yes, sir.
Yeah.
Yes.
Yeah, he's.
Please, sir, please share your good practices with us.
थँक्यू सर रगाडे सर. काही विशेष काही नाहीये, परंतु एक नवीन जोश म्हणता येईल की डिप्लोमा पण झालेला आहे, डिप्लोमा इन फार्मसी केलेलं आहे अमृतवाहिनी इन्स्टिट्यूट संगमनेर मध्ये. आणि माझं बी फार्मसी गव्हर्नमेंट कॉलेज ऑफ फार्मसी कराडमध्ये झालेलं आहे. तर आता माझे शिक्षक पण ऐकतायत, थोडस प्रेशराईज होते मला. परंतु तेच सर, जो माझा काही मला जे काही शिक्षकांनी शिकवलं आणि माझा जो काही इंटरेस्ट होता फार्मसी मधला, तसंच याआधी जे काही मी काम पण केलेलं आहे, फार्मसी शॉप वरती केलेलं आहे, एमआरशिप केलेली आहे आणि इंडस्ट्रीमध्ये पण केलेलं आहे. आणि माझ्या ऍक्च्युली शिक्षणाची सुरुवात मी 27व्या वर्षी केलेली. आता माझं वय 34 आहे, तर मी 27व्या वर्षी डी फार्मसी केलं. त्यानंतर मी डिग्री केलं आणि त्यामुळं ती एक आवड आणि विद्यार्थ्यांना समजून घेण्याची एक कॅपॅसिटी माझ्यात आली आणि तेच मी विद्यार्थ्यांमध्ये इम्प्लिमेंट करण्याचा प्रयत्न केला. त्यांना विषयाची आवड निर्माण करून दिली आणि जसं काही बेसिक कॉन्सेप्ट डेफिनेशन्स असतील, त्याचं क्लासिफिकेशन, प्रॉपर्टीज, युजेस एकदम पक्क करून घेतलं विद्यार्थ्यांकडून आणि त्यांनी पण केलं आणि त्यांच्या प्रयत्नांना यश आलं असं म्हणता येईल आणि त्यातूनच हा रिझल्ट आला असं म्हणता येईल. तर सध्या मी डॉक्टर इथापे इन्स्टिट्यूट संगमनेरमध्ये काम करतोय. तर नवीनच होतो, पहिलंच वर्ष होतं आणि झाला तो रिझल्ट त्याप्रमाणे.
Congratulations, sir. Great efforts.
Thank you, sir, for appreciation.
Thank you, Kiran sir.
Thanks, sir.
So yeah, we'll be closing today's session. Thank you, everyone. We'll start again tomorrow at 10:20 AM. 10:20 उद्या जॉईन व्हायचं सगळ्यांनी. सेम लिंक असणार आहे, सेम Zoom लिंक वर तुम्हाला क्लिक करून यायचं आहे. थँक्यू.